Oh, l'ho visto. C'è il microfono aperto.
From Europe, and so what was complicated until last year, now it's even more complicated because we have to save a bit more money for trying to recover our problems, and so it's quite difficult to strike a balance with the needs which are growing, in particular on health. And so there's a real need for the minister and his staff to try to be every day claiming for a renewal of our funding. So I regret not to have her with us, but I fully understand that the situation could not bring her with us. So I will not spend too much time, but before having anything, I would like to thank our colleagues from the Italian representation of the European Commission for hosting once more, not because it's not the first time here for us, and I would like to give the floor to Vittorio Calaprice of the representation to have the greetings of them for us. Thank you.
Okay, good morning. Good morning to everyone. It's a pleasure to give my welcome to institutional welcome to all of you to this Spazio Europa, Europe Space here in Rome for this showcase event on synergies for integrated care. My name is Vittorio Calaprice. I'm a policy analyst and work here in the European Commission representation in Rome. What is Spazio Europa is a venue managed jointly by the European Commission representation in Rome, the embassy of the European Commission here in Italy, and the European Parliament office in Italy, with the main goal to promote awareness, to debates, and so on European issues. Today, we gather to discuss a shared mission to reinforce health systems and advancing integrated care across Europe. Just a quick reminder of our journey together. As mentioned, Professor Nicoletti, I had the privilege of helping organize the first workshop of HaDEA on EU funding programs Synergies here in Rome in June 2023. And I'm sure Director Marina Zanchi remembers not only my commitment to ensuring a successful event, but also our efforts to promote these digital and also health initiatives at the representation. Once again, we are bringing together the expertise of the HaDEA along with several experts to tackle critical health challenges such as cardiovascular disease, diabetes, mental health, and reinforcing so the EU-wide initiatives through programs like EU4Health and Horizon Europe. Let me just confirm our commitment to build on this cooperation with between HaDEA and the representation in Italy, and I'm confident HaDEA also could recognize the importance of this partnership. Say that, I have to give the floor to there are the video. So okay, just the video of the main some speakers, and in this case the Director General Gallina. Let me just to thank all of you, wish you a productive event, and once it concludes, to enjoy Rome and its sunny days. Thank you. Bye.
So I asked the technician if you are ready with the video. Okay, so we can start with the video of Director Gallina.
Participants,
good afternoon. I would like to thank the organizers of this event, first of all, and HaDEA for bringing us together to discuss synergies for integrated care, that they can strengthen all our healthcare systems. Integrated care is vital to ensuring that patients receive coordinated, continuous support across all levels and types of healthcare. Now, this approach improves health outcomes and maximizes also resource efficiency, something that is quite good. As demographic aging presents a growing challenge, the 2024 Aging Report projects that healthcare expenditure could rise from 6.9% of GDP to 7.7% by 2070. Now, by discussing and by focusing on prevention and promoting healthy aging, we can improve the way we spend our money. Integrated care models are essential in this effort. They bring together services across primary, secondary, tertiary, and also community care. They ensure that patients, particularly older people with complex needs, receive comprehensive care. This is extremely important. Now, by harnessing digital health tools and promoting strong primary care, we can deliver even better outcomes, improving the resource use, as I have just mentioned. This is also the main lesson that we learned from the important legacy, the joint action called Jade Care, that was co-funded from the third health program and which supported national health systems for digital transformation. So that was the past. Now, the European Commission supports integrated care through the EU4Health today with a program that co-funds relevant joint actions that are led by EU member states to promote the deployment of best practices across Europe. Now, key innovations like the European Health Data Space or, for instance, the European Health Record Exchange, this will all allow healthcare providers to access and share patient data across borders, so that we can improve the care and the coordination of research capabilities also. Preventive health is, I would say, crucial. Through the joint action Prevent NCD, which is supported by 76 million euros from the EU4Health program, we are trying to address the common health determinants for cancer, cardiovascular disease, diabetes, but also other non-communicable diseases. We are contributing to the efforts to address mental health issues through 11 million euros in funding for policy dialogues working with WHO and 9 million euros for the EU Promens initiative, which provides training for healthcare professionals across Europe. Now, I lavished on you a few numbers. I would like to mention also the European reference networks that exemplify how the EU fosters collaboration to support patients and in rare diseases. And I would like to mention the joint action JARDIN, which represents a pioneering 3-year project on the integration of ERNs into the healthcare systems. This is the professionalization that I would like for ERNs. The contribution in this joint action is 15 million euros. I would like to say that I'm very pleased to notice from the program of this event in Rome that several of the EU4Health joint actions will be actively contributing to the different panel discussions. And I would like to conclude by saying that aligning efforts across programs such as Horizon Europe and EU4Health allows us to build a resilient, integrated healthcare system that meets the needs of all citizens. It's also a matter of equality. I thank you for your dedication, for all your work, for your personal commitment in some cases to this cause. So many thanks, and also successful proceedings and also the future work. Thank you.
We thank the Director Gallina. We should have a second message, this time from the Director of DG Research, RTD, Irene Neustadt. Just a few seconds and then we'll.
Ladies and gentlemen, esteemed guests, colleagues and fellow healthcare and research professionals, I am sorry I cannot be with you today in person, but I'm happy to be able to address you today like this for this crucial topics that it has a potential to really revolutionize the way we could and should deliver healthcare now and in the future. Integrated care is not just a buzzword. It is a fundamental shift in how we design and deliver healthcare services. It is about breaking down silos and fostering collaboration between healthcare providers, public health professionals, and community organizations. By working together, we can create a more effective, efficient, and just approach to healthcare, one that prioritizes prevention, lifelong support, and accessibility. The statistics are stark. Non-communicable diseases, such as diabetes, heart diseases, and cancer, account for the majority of deaths and disabilities worldwide. These conditions are often preventable. Yet they continue to plague our healthcare systems. By integrating care, we can identify and address the root causes of these diseases rather than just treating their symptoms. But integrated care is not just about treating diseases. It is about promoting health and well-being across the lifespan. It is about providing equitable access to healthcare services, regardless of one's background, income, or social status. It is about ensuring that everyone has the opportunity to live a healthy and fulfilling life. Accessibility and equity are at the heart of integrated care. By designing services that are patient-centered, community-based, and culturally sensitive, we can reach those who are most in need. We can address the social determinants of health, such as poverty, education, and housing, which has a profound impact on our health outcomes. But integrated care is not just a moral imperative, it is also sound investment. By preventing illnesses, reducing hospitalizations, and improving health outcomes, we can reduce healthcare costs and improve productivity. We can create a more sustainable and resilient healthcare system, one that is better equipped to meet the challenges of the 21st century. So what can we do to realize synergies in integrated care? First, we must prioritize collaboration and coordination. Bringing together healthcare providers, public health professionals, and community organizations to share knowledge, resources, and expertise is the key to success. And we must create a culture of trust, respect, and open communication. Second, investments in prevention and early intervention. We must prioritize programs and services that promote healthy behaviors, detect diseases early, and provide timely treatment. In addition, the social determinants of health, such as poverty and education, have profound impact on our health outcomes and how they should be considered. Third, we must prioritize accessibility and equity. Services should be designed to be patient-centered, community-based, and adapted to the cultural settings. Every person should have access to healthcare services, regardless of their background, income, and social status. Finally, measuring and evaluating progress. Outcomes should be tracked so that one can identify areas for improvement, and also to identify any needs for developing solid evidence bases for the proposed changes. We truly hope that the EU-funded programs, partnerships, and projects, of whom many are being present here today, will make a difference and help us move closer to all those objectives. In conclusion, synergies in integrated care have the potential to transform our healthcare systems. I therefore urge you all to work together on this journey, to share your knowledge, expertise, and passion for creating a better healthcare system for all. Use meetings like this to create those contacts that can bring us forward to provide better integrated care in the future. Thank you for listening, and I wish you all fruitful discussions today.
So thank you for these two very impressive messages, and we were very brief introducing the next speakers. So as mentioned by Vittorio, we had already 2 years ago, more or less, one apparently similar event on Synergies, still under the umbrella of HaDEA and still in Rome, which is we want to thank for this, and it was a 2-day event. The first day was the objective was to let the individual networks or the different programs which are under the umbrella of HaDEA, which is not only health, but it's also research, cluster health, and the digital space, many others. So, and the second day was to let's say, to showcase to the stakeholders, first of all, to present this focal or contact persons, and then to let understand the possibilities offered by the new agency in order to progress. Now, I think this time we have a different objective, is to really showcase, as mentioned by the title, that these synergies are already in place after 1.5 years. In particular, looking to a number of initiatives and particular projects, and in particular, but not limited to that, joint actions, which are the key part, or one of the key part of the EU4Health program, but still in close connection with other programs. So I'm happy to introduce once again Marina Zanchi, which is Director of HaDEA, and I would like to hear more about what happened since we met last time, and I'm sure you have a lot of things to tell us about this. Thank you. The floor is yours.
So, oops, sorry, too much paper. Good. So thank you very much again to everybody. Good afternoon. And I thanks really, very happy, first of all, to be back in Rome. It was June last year. And as Giovanni said, it was a much more general approach on synergies. The first time, really, we had an event talking about synergies. And I'm very, very happy to say that we have done a lot since then. I start, as usual, by thanking all the organizers. It's a long list because everybody was cooperating very closely with the HaDEA colleagues. So I want to thank all the national focal points for the program EU4Health. In particular, the Italian coordinator. That's why also we have this event in Rome, the Ministry of Health, and the Promise for their really excellent work. I would like as well to thank the national contact points for Horizon Europe and the APRE, that is the coordinator of this network. Last but not least, this morning we discussed and we had a very good event for JACARDI. So I thank JACARDI as well, which is a joint action for, cardiovascular diseases and diabetes. And finally, definitely not least in importance, the European Partnership for Transforming Health Care Systems. So a big thanks. With all this long list of people working together for this event to become a reality, you see that Synergies is embedded also in this event. Now, if you allowed me, we are a young agency, not anymore new, but very, very young agency. And if you allowed me, I would like to say very few words, at least just to wrap up on who we are and what we do. Now, let me see, because, yes, no? Somebody should have. It's coming. Qual è? Perché non prende? Well, I can cite. Well, few words I can talk and then you will see the slide. I hope it works because there are lots of slides. Doesn't work. It works. Good. So we can escape this. So few words about HaDEA. As everybody knows by now, HaDEA is an executive agency, one of the 6 executive agencies of the European Commission. You know, we implement programs delegated, funding programs delegated by the European Commission. And we were born, you know, under COVID, because I'm always reminded this, the reason of being there is having a better, healthier, stronger Europe. That's why we were born as a reaction of COVID, but we will continue to live. And that's why the two main pillars are health and digital, because future and innovation without digital, it is not possible. I just want to recall that we have a very big mandate. Now I don't have any. Okay, good. We have a very wide mandate. Oh, can you hear? Good. We have a very wide mandate. As you can see, I always say we cover the research part, the two clusters, one for health, cluster 4 for digital, for the three strands of cluster 4, which is digital, industry and space. But we have more, as Giovanni was mentioning before, a wide portfolio, because we deal also with food safety, which is a strand of the single market program, plus the digital CEF and DEP. The Connecting Europe facility, practically the 5Gs, Connecting Europe facilities, but also Digital Europe program. So to have new technologies, innovation in the digital area in Europe. The next slide, it's very dark, the light blue. It's our budget, it's the updated one, because as you know, when the agency, as you may know, when the agency was created, we received a budget covering 7 years of mandate, and it was a bit more than 20 billion, divided more or less quite equally between the strand of health and the strand of digital. And you can see from the colors, the yellow and orange is a part of health, the programs I mentioned before, and the blue, and the very light blue in this slide, is the part of digital. Now, you might know we had a midterm revision of the MFF, Multi-Annual Financial Framework, and there was a cut, unfortunately, because I was very unhappy, I must say, in the health, EU4Health program of a bit less than 1 billion. So this is our current budget that we have to spend until 2027, and you can see the numbers. That's all I wanted to say. But so just to put the context. Now, just to put the synergies into the context, what do you intend? What is the definition of synergy? Now, we don't reinvent the wheel, so we use the very good definition available in the action plan for synergies done by our colleagues in the Commission Services of DG Research and Innovation that you can read there. But what does it mean in concrete? In concrete means that we create bridges between two or more funding programs. So we make the programs talking together, working together for a same purpose, for a same aim. Why is that necessary, particularly now? Because we want to maximize the value. It's a moment where we have to use every cent the European Commission has in their portfolio to have a strong impact in Europe, to make the difference, to have a value, and not only, also to have a sort of leverage in the investment. That's why we open up and we talk more and more about synergies, about synergetic way of working. Now, voila. We have two major I would say main types of synergies. This morning, we have been working in a very interesting event for talking about synergies by design. But there is a second one, which is the synergies by implementation. Now, synergy by design is, as I said before, foresee already a level of the program, a level of the policy thinking to make it possible two different programs working together at programming level. Sorry, I make the example, you will see afterwards, I will give you examples, so it will make it probably more clearer. Whilst synergy for implementation, there it's where HaDEA is playing an important role. Because in the agency, we really do promote the foster of the synergies in the implementation. And I will provide example afterwards when I'm going more in details to better understand our role in helping becoming synergies a concrete fact and not only a nice word. Of course, synergies can be, as you can see from a slide, within the same program or with more between programs, but also between projects. So there is this possibility. There is an echo sometimes. Can you hear me? You're not disturbed by the echo. Okay. Now, again, just to show how wide it can be when we are talking about working in a synergetic way. We can have complementarity, as you can see from the first and the last design, in two different ways. Complementarity of the funding, when we bring together the funding, as I mentioned before, of different programs, just to focus on the same result, on the same project. But you can have also two different projects working together in parallel in a parallel path towards a common, I would say, result objective. We are also talking about sequential funding, which is in the name, and that's really because we were discovering also by looking at the projects that sometimes you have excellent projects, which provides excellent and very good useful results, but we don't want to lose those results. So when we say sequential, is another project that builds up on the results of a previous project that is finished and continues the same path, the same way. And the last case, I would say, is the alternate funding. What do I mean for that? Sometimes, for question of really the way we are working, we have a maximum amount to spend, but during the evaluation, we see that there are very good projects that unfortunately cannot be funded by the EU funds, but not because they don't have enough good qualities or enough description in the deliveries, but simply because we have a limit in our funding, co-funding of the projects. And in that case, also in EU4Health, because I'm referring in particular to that program, we are going to apply, we just started to apply the same approach that RTD and also I think the DG Regio for structural funds they applied. What do I mean for that? They give a sort of seal of excellence, which means they are good projects. They are excellent, but there are no funds possible for them, but they can participate to other programs where the funding are available, and they're already, I would say, signaled as good projects. So they go faster in the evaluation and they are considered easier eligible, I would say. This slide is very dense, but practically has been said, everything has been said already in the video of our Director General, Sandra Gallina. Because this is, if you want to reply to the question, why do we have to talk about synergies? And what do we mean for that? As it was said already by Sandra Gallina, a bit of visualization and a bit of visualization of what Sandra said. With Synergy, we really want to we are fostering the linking of all different levels of care. I'm sorry for the echo. I hear myself, I don't know whether you, okay. It's me that I hear strongly. Linking all the different levels of care, that was the primary, secondary, tertiary, and also community level that was mentioned in the video. And that is a way of synergies in integrated care. As you can see in this part of the slides, HaDEA with the projects in HaDEA, because it's not something that we invent for ourselves, but it's something that we notice by looking at the projects, by seeing what is at stake. We strongly encourage the transformative process that can allow really the healthcare systems to set up the three strands you see there, the collaborative teams, cross-disciplinary trainings, and coordinated structures. Another important aspect is the digitally integrated care, which is the picture on the top, where I can give you already an excellent best result, I would say, which is the legacy action. When I talk about legacy, meaning because it was done and funded by the previous health program, the third health program, and the name is JACARDI. And if I'm not wrong, is with us a representative of this project, a Spanish colleague, I think,
allora magari
who will go
sentiamo
more into
poi la
details
traduzione,
in
però-
the next meeting we will have later on. Linking physical and mental health, another integrated care, and for this
Ma voi
we have
riuscite
organized
a
also some
controllare, verificare il
showcase
problema se non c'è un evento?
example. And we really foster this integrated approach
quindi-
because it goes hands in hands, the physical problem, health problem with mental health problem. And the Commission has also dedicated important budget on these points. And to conclude the description of these slides is that nice picture in blue you say and in the corner, which is promoting the equity. We have been talking also this morning of the importance of the equity, the importance of looking at the health problem for the category of patients who are the most, I would say, how to say, not the most, thank you. And there we look and I notice in the projects you are doing for both angles as a group of more exposé, on say in French, exposed, thank you, most exposed patient, but also individual, because it's very important the context. And we really want to talk about inclusion, about equal access to the treatment. And we frequently speak, and I saw in the reports also the projects, but also in HaDEA, of patient-centered integrated care. There are 4 very small words, but extremely important nowadays. And with this, I would pass to Zoom a little bit more into, just to say a few words. I'm sure you know them by heart, but I like once again to recap the EU4Health and Horizon Europe. EU4Health, everybody's saying it's not a new program. It is a new program because the predecessor, the famous legacy I was mentioning before, had a budget of $500 million to be spread over 7 years. Now, you saw before, we are talking about 5 billion, now a bit less because we had the cut, so we are talking about 4.5, 4.6, spread on 7 years. But when it was adopted, it was over 5 billion. So you can see just in the budget the difference or the weight of such a program. So for me, it's a new program practically, even if, of course, continues the legacy of the Third World Program. And it's a clear, concrete demonstration that public health has become a real priority in the Commission, because the Commission at the end represents member states' priorities, so we are not isolated in ivory tower. If you turn, voila, and you can see the synergetic integrated care, because it goes together, synergies and integrated care. It is really spread across the 5 thematic strands that you can see there. I just want to spend 1 word of cancer. As you know, cancer is by nature, they are cross-cutting, extremely important, and digital transformation, I was just mentioning also before, but also in the message of Sandra Collina when she was talking about e-prescription, when she was speaking about the importance for Europeans, but not only, to have access to the digital health data across all Europe. And that's embedded in the program EU4Health. Quickly turning for the research part, the famous cluster 1, health, again, with a big budget again. These programs, cluster 1, has 6 thematic destinations. And you can see that they really link in the program, in the destination, the importance of health and digital together. Also for research and innovations, also to dig in to even more foster and more improve these aspects. Only a few words, but let me spend the famous cancer mission. By now everybody knows, but it was an innovative approach to have a mission, to have a mission that it is cross-cutting, concentrating in a big health issue, which is cancer, that should be tackled from the different angles. Once again, all the resources, not only budgetary, but also intellectual, also skills put together in order to have a stronger impact. And least but not last, I say for the second time, the partnerships, the Horizon Europe, European partnerships. And I'll give you an example because it's here as well, I think some representative of the Transforming Healthcare Systems, THCS, that are really concretely in their job, in their work, promoting synergies in order to reach better integrating care. As I was mentioning at the beginning, few examples, because it's always good, I think, that you see in concrete, because it's nice to hear and to listen to what I'm saying, but I think it's always more impactful when you see facts. Let me quickly go in through a couple of examples. This is some of the people present in the room knows very well because they are representing JACARDI and the other actions. It was an important event this morning. It was a milestone. I'm talking about JACARDI, which is a joint action of 53 million, working hand in hand by designing to have a collaboration with common milestones and with common deliverable with 9 grant actions. So this is synergy within the same work program. It was work program 2022, so now it's more than a year they started working together to get stronger impact. So just the image, you can see all the representative of these extremely interesting projects. What I wanted to say, the total amount is 57 million, 53 only JACARD. Now I have 1 or 2 examples of synergies, in this case, between different programs. Again, a very dense image. But what I would like is, I'm talking about 4 programs working together. There is Horizon Europe, there is EU4Health, and the legacy also together now, yes. And there, for example, you can say where you see several little words, a sort of cloud on the left. Why? Because these are all the areas where the European Union, together with you and all the participants, are working and digging to find solutions via thanks to research and innovation. So that's all the areas. So you can see how vast is the area where we work, where we implement. And you can see the budget. Talking about Horizon, we are talking anyway about 510, more than 510 million, and 76 already existing grants, but more will come with the next calls. Now, going to the part, same slides, to the part of EU4Health, the amount of budget is 42 million, but they have 2 different instruments in EU4Health. That's a big difference with research, because in some cases, we use the instrument on procurement. When the Commission decides to buy a service or a product, example, buy a vaccines, the monkeypox. These are examples where HaDEA is working with public procurement. And it's a big difference with Horizon Europe that practically doesn't have this kind of procurement. And the difference is, of course, then in the first Horizon Europe, we talk about research and innovation. In the second one, now we are concentrated about the best practices. So to deliver, to share with European concerned hospital, European patient, with everybody, the best practices. And thanks to what I said before, digital, we are talking about best practices portal, which is extremely accessible and very, very useful. Now, we have done events to have showcases because we strongly believe that it's very important to put people together, physically or not, or hybrid, but put people together, people involved, to talk together about common subject. So HaDEA does, from time to time, showcases event, and we have done a very important one on mental health. I think it was last year in October, if I'm not wrong. I recall the EU promise, mentioned again by my director, our Director General, Sandra Gallina, where is a procurement action, and it concerns important training for all the health professionals. So once again, it's a sort of also exchanging best practices. You can turn, I think. That's the second example I wanted to mention. I will be very brief. But there, it's not only physically the programs that sharing the funds among the programs dealing with health, namely the famous Horizon Europe, the Legacy Horizon 2020, the current U4Health, the Legacy Third Health Program. But as you can see, there are two different programs there. The Digital Europe program and the CEF, where I was explaining before very quickly that the CEF is connecting Europe facilities, so the 5G, but also submarine cables, everything which allowed us to connect rapidly in Europe, and also not only in Europe, but further beyond Europe. And the Digital Europe program, with quite an important budget contribution, that is dealing for new technologies, so experimented new technology. And in these slides, you can see in a glance the synergies by implementation between all these different programs, but all managed by HaDEA. So really, I insisted that this agency was created with the spirit of having synergies, of having integration of the programs, of the projects, and of course of the results, but this for the benefit of Europe, to have a stronger Europe, more independent Europe, and healthier Europe, and more modern, technologically advanced. Don't worry, I'm almost finished. It's long, sorry. The synergies through cooperation. And here it's you. It's all the networks. So here it's really all the people participating to this event, that you helped in having these events. And as I said, I always like to create networking of networks. Because when I arrived, I was coming from Horizon Europe, so I was more knowledgeable in Horizon Europe, so I knew already a lot about the national contact points of Horizon Europe, and I discovered another network, and I thought, but they should talk together, they should exchange best practices together. That was one of the first meetings I had also here in Rome with the different representatives of the national contact points and focal points, and I warmly thank you, because they are doing an excellent work, and without you, we will never have such a successful, because they are successful projects. So really many thanks from HaDEA for the excellent work you are doing daily, not only when we have to organize this event. And there you can see what I was talking. Just a big thank to all of you, and I wish you really fruitful, useful, and impactful discussion today and tomorrow. So many, many thanks.
I wanted to ask Marina if she could say a bit here, because I was wondering, based on the very, let's say, extensive and detailed lecture that you had, if maybe it could be worth to have a couple of questions now and not waiting the debate that we will have after the next speakers. So is anyone, we have the microphones here somewhere in the room, so is anyone willing to have questions for Marina? Yes, please, Zoltan. Where is the microphone, please? Oh, yes, but maybe the microphones were here and so.
So just a question on prevention, right? I'm Albert Zoltán Asszalos from JACARDI project as a leading communication, and my grandfather was a doctor, and he wrote in a medical journal in 1936 that prevention should be in the focus of activities of doctors, and this is how they should be financed. And I see that this is like a debate, a century-old debate. Do you think that with EU4Health projects and Horizon projects, you can really push prevention to the core of healthcare activities, or what do you plan to do for it? Thank you.
Please always introduce yourself also for the colleagues out there. There's a question there.
Thank you.
Please
Hello,
introduce
everyone.
yourself.
My name is Magdalena Decor. I'm from FH Europe Foundation, a network of patient organizations for familial hyperlipidemias, so CVD risk factors. And today I represent the Perfecto Consortium, which is early FH pediatric screening. Thank you once again for the second part of the day. In the morning, we had a fantastic meeting and everything you've mentioned. My question to you and to the people in the room is, how can we collectively, with everything that we do through JACARDI and now the action grants, try and encourage more thinking, acting, and true implementation of prevention when we talk about a person rather than a patient. I think if we got to the stage of a CVD patient or a diabetes patient, we have collectively failed. So I would like to see how we can try and drive a narrative where we talk about primary prevention in the context of people rather than just disease and patient. Thank you.
Thank you. Any other question? Yes, please.
Yeah, hello. I'm Nicola Di Flora from the European Alliance for Personalized Medicine. We're talking about synergies. I was wondering whether there were also synergies between missions, because there is, I've seen the TRAMI network that was going on, which was collaboration between missions. And my second question would be, is it also foreseen a collaboration between continents? So Europe, America, for instance, Latin America. Thanks.
I think you can, if you are ready, you can try to answer the first three questions.
It's good we have something in common, because my real grandfather was medical doctor and he was talking about prevention, my father told me. So we have something in common. No, you were talking particularly about the importance of prevention. Of course, it's fundamental. And it's something that we tackled more recently, because if you think, we always speak about taking care, managing, but prevention is something big priority. And how we can help in HaDEA, we can help when we feedback, and I partially reply also to some of the question, when we feedback, this morning I was mentioning, the commission services. Because we don't do the policy ourselves. There is a clear repartition, if you were in my speech, the commission services are listening to member states, they do the policy, they do the program, and they do the work program. But there we come in. Before they finalize the work program, we have our input, our say. And there we can inject what we hear from you, what we see, because we are a good listener in HaDEA. We take note of what you're saying, and we see the project. So we see also the demand, we see what is at stake. So what we can do is to continue to work in via the way of feedback to policy, to inject and to push, because I think you use the word push, this principle, which I agree with you, is extremely important. Prevent for me is even much better than taking care afterwards, via this way, because that's the only voice we have inside the commission. Not only, I would say, frequently we have colleagues participating in meetings with the commission colleagues where they discuss really technical, and some of the colleagues are here because the head of unit as well as continuous contact with the commission services, and via that they can also take this point and put it on the desk. Now, if I'm looking at the other lady, I forgot the name, sorry, you were, your question, because I didn't have a pen when you were asking, it was for programming, no. Primary prevention, but it's a bit linked, it's a bit linked what I say. I must say, once again, the integrated care, it plays a double role, because you also work on prevention and on caring. What we are doing in HaDEA, because I can speak only for my own house, if you want to say, we promote workshops with the commission and with the beneficiaries, because there we have the showcases, to discuss these issues, this point. So we organize workshops, we organize meetings, and we have always a representative of HaDEA when meetings organized by the commission. So it's in this communication that we can work and we can have a major impact. And somebody was asking about international, in other continents, but The programs are European programs, but there is the aspect of international cooperation. So there are programs, it depends on the legal basis. So every program is a bit different. For Horizon, we have a lot of countries associated. Also for EU4Health, not necessarily the same. And we have much more associating countries in Horizon Europe, probably because also it's an old program, very well known. But in order to collaborate, there are specific criteria that varies between the different legal bases of different programs. And I can talk also about the SEP, DEP, all the programs. So once the criteria is followed, it's open to the world, but must follow legal basis and legal criteria foreseen. I don't know whether I replied to everything, but I didn't have the pen at the beginning.
Thank you. My name is Linda Granlund. I'm the project manager for Joint Action Prevent NCD. And I just wanted to comment on the question about prevention, because obviously our project is about prevention of disease, of NCD and cancer, and the determinants of health. And we are working very closely together with JACARDI and looking into how we can work together and also look into the social determinants of health. So, but I really liked the question and needed to comment on that. Thank you.
To work together, this is a good example today, I think. It's one good example how to work together. As it was mentioned before, it is not the first one, and definitely it will be not isolated of the last one. But we like to work on concrete cases, like this morning as well. Thank you for the JACARDI for having organized that, because they are even more important to meet all the representative and the coordinator. That's, for me, must be very concrete actions, maybe not too big, but very focused and concrete. What I can tell you as director of HaDEA, that every time they know, because I bother them, every time I have a management meeting, I'm talking a lot about being concrete, organized, keep strong networking with the beneficiaries, strong networkings with the national contact point, national focal point, by organizing showcases, because the excellent, magnificent things are happening in the Commission, but they are not known outside. But if you start to spread, you can see also the concept of prevention. When you start talking about the concept will become familiar. I'll tell you something. At the beginning, when I was talking about synergies, everybody was looking at me to say, what do you mean for synergies? Now, more and more, when I'm going in conferences and I'm talking about synergies, I see from the eyes that you know already what I'm talking about. So also having events, workshops, collecting what you are saying. I repeat, we should be good listener in HaDEA, and maybe drafting, I'm looking at my heads of unit, drafting some reports. Do you want to compliment? Can I pass the floor to the colleagues? Anything to compliment? Please. No, because they are the ones working every day in the field, so I'm sure.
Good afternoon.
Stefan Hogan, our head of unit for Horizon Europe.
For research, Cluster 1 and the Council Mission. Yeah, I mean, we have a fairly systematic approach to trying to stimulate, encourage synergies. I mean, as Marlene says, there are synergies which are expected from projects when it is built into the topic, when there are demands put on the projects to meet, to deliver, have common deliverables. But also for every topic, a few months after the projects are launched, we organize systematically for all the projects from each topic a meeting to give the opportunity to explore the possibility of synergies. Now, we know that in some topics where it hasn't been designed into the program, there's also sometimes an affinity between the projects that makes it potentially interesting for the projects to continue to meet. So we create that first opportunity. And indeed, if the projects, the leaders of the projects are interested, then we will continue to facilitate that. So this is one of the ways in which we try to systematically bring this about. We've been doing it for all the projects since the 2022 calls. We didn't manage in 2021, we were just getting started, but now we're doing it systematically.
Ugo, do you want to comment? No. Is there any other question? Because otherwise I would like to have a very short questions from myself. And first of all, thanks for mentioning the national focal point and the contact points as your partner in this attempt to do on synergies. Just to partially, it was already presented, but for sure it's key that you have only one agency to manage such a sort of very different programs. But even having one agency means having a big organization. So how you manage internally to have these synergies at operational level, because I assume that there is not one officer that can have the whole portfolio in the mind, so, and how you concretely manage. I'm just asking this question because this also was apparently coming from a quite different group in the last group on cancer and subgroup on cancer, or the public health expert group. There was a presentation by these Belgian colleagues, which are very successful in joint actions and in Horizon everywhere. So they, in practice, in a few years, they have a number of projects in their organization and in their unit, which is incredible, something like 30 projects, something like that. So for them, they were not able to do that on an individual basis. So they had to create some tools in order to understand the possible synergies for the project that they were managing, let alone of the project that they were not coordinating, but they had some kind of cooperation, or they were partners or something like that. So I was wondering, but this is your experience first that comes, if we look forward to have some kind of, I don't say artificial intelligence tool or something like that, in order for the future to really understand in a very let's say easy, relatively easy, and also not so time expensive way, the connections, also the timelines where we have to create these bridges, the persons which should be involved. And so it's something that it becomes very difficult to be managed by only one organization, let alone from one person. I think it's not maybe a challenge for today, but if we're looking a bit in the future, I think it's something that I am a bit too old to face this kind of challenges because just to mention some personal experience, the reason why the Ministry of Health is tolerating still to have me inside is why I was really a bit famous, because I was the only person which more or less was able by heart to know the title and the contents of the joint action or some of the project. Now I give up to just try to keep the one of the year because it's already quite challenging. So I was wondering who the people who manage such a big portfolio, and so I think it's quite challenging. The second question, which maybe you have already a bit responded, it's very clear how the policies from the European Union come to you for implementation. I think it's not as clear as the results of what you implement are feeding back the policies. And I think it would be pity if this does not happen, because in practice, one of the big discussions that we have in the council everywhere is the lack of self-produced evidence. So there is always someone which is questioning, okay, this in particular for primary prevention was mentioned, how this kind of evidence was produced maybe in Latin America or in the US, so maybe not entirely applicable in Europe. So, and on the other side, now we have a number, and with the future will even more projects that self-produce evidence that the member states have produced themselves. So to a certain extent, it will be not that easy to, let's say, to counteract and denegate the results of what they produce by themselves. But it's just a question, maybe it's a bit outside of the scope of your.
So for the first question, yes, we are a big organization because there are around 500 people. 500 people who are managing, as I was saying before, 5 different programs with a huge budget, and apparently different, some of them, even if under a synergetic way, and with different legal bases. So it's really an entire world. So for me, the magic word was to go ahead, to advance in an organized way, because it's a sort of piloting. I repeat, synergies, I've heard about the word synergies also in the previous program, because we were talking about synergies also in the previous program, but there was nothing in concrete. So now we started to say in HaDEA, we should create a sort of structure. So the idea came, I appointed a person that works directly with me as a synergy coordinator. And this person as a contact person per program. So it's already a network. So to create, as I said, I like networking, I like communication, to create an internal network where there are meetings, exchange of information and between different programs inside the house of HaDEA. And that person is coordinating, is keeping trace, is creating reports. That's one action. Another action, I insisted a lot, as I said before in the management meeting, to my managers, pay attention synergies, pay attention. So it's something that it comes clear to everybody that, and I see them knocking the hand, so you agree, that it's a priority for HaDEA. So everybody's listening more attentively. Thirdly, I make sure that when the commission services are talking about synergies, I have an HaDEA representative who can go there, talk about our experience, talk about what we do, and listen what other services are doing. Then we started last year, I think, only to create an inventory, a sort of list, as you were mentioning before, of all the colleagues in the different sector who deal on one way or the other with synergy, or who have, in order to make sure that we know who deals with the same subject from different programs, okay? Cancer, who is working in cancer in NFP4Health, who is working in cancer in Horizon Europe, in digital. So it's a sort of inventory, creating another network, and then networking among networks. It seems complicated, but in reality, it's easy. You appoint people motivated, and things goes along. Then I promote more than once internal workshop in order to have these people to meet, to talk, to discuss, to have showcases, workshop with the commission services. We always try to work hand in hand with the commission services. And recently, I also invited the Director General, Faisan Fonction, Magnam of Joint JRC, because they work a lot, you were mentioning artificial intelligence. And so I said, come to HaDEA, listen to what you're doing, tell us what you're doing, and we will have a meeting soon to see whether we can use some tool for that. So we are thinking of having a sort of tool. We don't have, so don't ask me now, we don't have. But the idea is also to have a talk, it's a pilot in this story. It's a sort of pilot project, this synergetic affair. But to invite also to see whether there are some, maybe other DGs knows more than us. So it's good to be curious and to see what the others are doing, because it's voila. Now, for the second question, which was, the way we are working. Again, I tried to be organized and structured because it's more efficient. So even for the feedback to policy, it's not a la carte, or it could be, but normally it's very well organized in the sense there is a common structure or the way of interacting with the parent DGs for the famous item and feedback to policy, which was what I was explaining before. So every year, at the beginning of the year, for every program, because I repeated the structure and the legal basis are different, but we colleagues, HaDEA's colleagues, meet with the commission services colleagues to individualize, to strengthen, underline the priorities for the commission. So where the commission wants absolutely to be kept informed of the results of our project. That's the feedback to policy. And we have a short action plan. So at least we know the milestones of that year, or the year to come, because we do this exercise in January, February, every year in a structured way. The structure is very similar for all the projects we manage. So we know in advance what are the expectations in feedback to policy from the commission services. And then, of course, we should be flexible because there are things coming up that you cannot foresee at the beginning of the year. But it helps to make sure that they receive systematically this reporting. And then we produce report, we produce event with them. That's a way the information go in rounds. I hope I answer. You can say no, but
I have to admit that there was this question was a bit also for making marketing of the event that we are organizing.
I will
in a couple of weeks in Lisbon at the
I will be
Public Health Conference, which exactly will deal in a more detail about this issue. Sorry, but just to inform all the colleagues, it's just 20 euros and the ticket to Lisbon, because it's clearly not nearby, but if you are interested, please come in. Thanks again, Marina. It was quite interesting. I think we have. Now, the next speaker is Beatrice Formenti from the Foundation Policlinico Gemelli and JACARDI Joint Action. Very happy to see that this panel is all of women. So once again, nice news. The floor is yours, Beatrice.
Okay, sorry for that. So, good morning, everyone. My name is Beatrice. I'm a project manager in JACARDI, and I'm truly honored to be here today speaking on behalf of JACARDI coordination team, Benedetta Armocida and Graziano Onder, and the team from University of Torino who support us in this task. So, let's begin with a quick introduction of JACARDI. The full name of JACARDI is Joint Action on Cardiovascular Diseases and Diabetes, and it is a joint action born from the HaDEA program in November 2023, coordinated by the Italian National Institutes of Health. The JACARDI involves 21 countries, 76 partners, and aim to implement over 140 pilot projects. The overall aim of JACARDI is to support EU countries in reducing the burden of CVD and diabetes and related risk factors, both at individual and societal level, while assuring health system sustainability and equity. We will achieve this by implementing cross-sectional best practice and testing innovative intervention across the entire patient journey. So I said patient journey, but what is the patient journey? In JACARDI, through our pilots, we focus on all stages of the care pathway. So we start addressing the healthy population, the people at risk of developing CVD and diabetes, individuals already diagnosed with CVD and diabetes and the risk of disease progression. And of course, these involve key implementation areas such as integrated care pathway, self-management, and also specific settings such as the workplace. As you can see from this picture, the patient journey is framed by two key umbrellas: the data availability and quality and the health equity. So the concept of our patient journey is translated within our technical work packages. So we have a work package on health literacy, on data availability and quality, on screening, on integrated care pathway, on patient self-management, and on labor participation. As you can see, all these technical work packages are guided by a new cross-sectional work package named Methodological Framework and Integrative Approach. Of course, one of the key activities in JACARDI is fostering synergies. So even before the official start of the joint action, we develop a really strong collaboration with GIA Prevent NCD. Today is a really good example for us, as this morning we just concluded our first synergy meeting with the 9 action grants. And the first year of JACARDI also has been productive in developing new synergies, as with the GIA National Focal Point for Health and also with the THCS, as we can see later after my presentation. So now let's go more into a practical aspect. So the main activities within our methodological framework are designed to guide our pilots over across all stages, from the context analysis to pilot design, implementation, multidimensional assessment, and sustainability from day one. all these stages are integrated with an equity-oriented approach. But today, we will focus on the first task, the country-level context analysis. And why? Why this is so important? So the decision to conduct a context analysis at the country level is rooted from the recognition of the importance of understanding the broader context when implementing a new intervention. So the aim of this analysis is to provide a comprehensive overview of the current status, challenges, gaps, and national priority related to specific topic within CVD and diabetes prevention and management. And we achieve this by developing a series of questionnaires designed individually for each of our 6 technical work package and specific disease, meaning that we have developed a questionnaire on health literacy and diabetes, another very similar on health literacy and CVD, and so on, resulting in a total of 12 questionnaires. Each questionnaire follows a common framework and is structured into 2 different sections. The first section is governance and financing, and it covers 5 key topics: the legal framework, the strategic framework, meaning the presence of national policies, strategies, or action plan, the intersectoral policy and practice, meaning the assessment of collaboration among different governmental and non-governmental stakeholders, the equity-oriented approach, and of course, funding. The second section is service delivery and capacity, and it's more practical session where in this section enable us to assess the implementation level of services at the national level. And to develop this section, each work package was asked to formulate the most relevant question for their pilot work and ultimate goals. So, but now here comes the challenging part, because who will be able to complete such a comprehensive and detailed set of questions at the national level? So we thought about it, and we need a method that could cover the entire European region, one method that was fast, collaborative, and of course beneficial to all the parties involved. So we reached out the coordination team of the JACARDI National Focal Point for Health. And on February, we had the first presentation meeting of this exercise, and where has been also highlighted the importance of this collaboration, in particular related to the National Focal Point role in supporting the EU4Health programs. Following a really strong interest, we had a second meeting, more practical, to give instruction on how to complete the survey. And finally, on April, we sent the survey to National Focal Point in 32 countries, and we have asked the 21 countries involved in JACARDI to collaborate and support with their respective National Focal Point. And how we are here to celebrate a successful story, because thanks to this collaborative effort, we receive responses from 21 countries across the European region. So thank you so much, all of you, for this. And the result of this exercise will be compiled into a comprehensive report. We are now in the drafting phase of this report, both at the European region and the country level, specific to each thematic area and disease, meaning that we will have a specific chapter on health literacy and CVD, another specific chapter on screening for diabetes, and so on. And of course, this report will be really useful to assess the maturity of policies, strategies, and services. We will present also these findings during a workshop to be scheduled between December and January. And this moment will be a really valuable opportunity for discussion on identifying gaps for sure, but also for advancing future initiative in the context, in the European context. So, just to conclude, why this our example of synergy is so important. Of course, together we enhance our broader understanding of the current landscape of CVD and diabetes. And for sure, identifying gaps is key for future improvement. But this exercise, these fundings are not just a result or an exercise for JACARDI, but are also valuable resource for European stakeholders and policymakers. But mostly important, we have fostered significant synergy that could enable us to achieve broader goals in the future. So, thank you so much. Yes, that's the last slide. Thank you so much.
Thank you, Beatrice. Please stay here, so in case we have questions from the floor. The next speaker is Laura Motta, which is also from the Catholic University, the university, not the foundation, so it's important difference in Italy. But she will present us another initiative, which is not from EU4Health, but from the research program. It's the Transforming Healthcare System partnership, which has been already mentioned several times today, but we want to hear more from you about the details. Thank you.
Hello, everybody. I've been already introduced. My name is Laura Motta. I work for the Catholic University. We are supporting the Italian Ministry of Health, which is the coordinator of the European Partnership on Transforming Health and Care Systems. How can I put the slides? Okay, thank you. So the European Partnership on Transforming Healthcare Systems, starting on the 1st of January 2023. 64 partners are contributing to the partnership from 23 member states and 9 regions, and it will last 7 years. The contribution from the European Commission is more than 91 million euro, and the total budget is 300 million euro. The partnerships is actually the results of previous initiatives, so it's not started from the scratch. But before the partnership, there were 4 other initiatives that joined together: the Coordination and Support Action to Reach, the JPI on Ambient and Assisted Living, the JPI More Years Better Life, and the European Innovation Partnership on Active and Healthy Agency. And before the partnership started, we worked together with a core group of member states that were supporting the launch of the partnership to develop the THCS Strategic Research and Innovation Agenda. And we came out with this temple that you can find in our SRIA. It is also available online. The objective of the partnership is to support member states and regions, actually support health and care systems to become more efficient, more sustainable, more resilient, more inclusive, more innovative, and more people-centered. And to do so, the idea is to focus on 7 thematic areas, in particular on the optimization of care and integration of services, on the healthcare systems financing, on the accessibility and inequalities, on the appropriate use of technologies, on people empowerment and self-management, and on integration of preventive strategies, as well as health and care systems preparation to emergency threats. And to do so, we need to not forget that we need to work on always on 7 building blocks of our health and care systems, which are the health workforce, the fact that we always need to involve people and users in our actions. Well, there is a strong focus on digitalization as an important tool for the development of health and care systems, as well as on the importance of measuring equality and safety. And also we need to always take into consideration the efficiency and the sustainability of the innovation. The partnership works on 3 main work streams. The first one is filling the knowledge, which means that we need to identify what are the problems and the priorities, both in terms of health system priorities, as well as research priorities that we need to address. But we need to learn from practices. There is a lot of going, of course, but we need to understand what we need to learn. So what is the best practice, how we can assess the best practices, why it is the best practices, and how we can implement and transfer to other contexts. The second work stream is the implementation and transfer, which implies that we need to test and validate solution. And the last work stream is boosting health and care systems, which means that we need to work on capacity building, on strengthening health ecosystems, and we also work on policy update, meaning that we need to support the development of policies based on research evidences. In order to implement the work stream, this is the structures of the partnership. We have 4 pillars. Pillar 0 is about the program management and includes, of course, in our package 3, an important part on synergies. Pillar 1 is about the science and innovation into policy and practices. Pillar 2 is one of our core pillars, which is about research and innovation funding. So under this pillar, we launch cascading grants and we manage projects. And pillar 3 is about the support, transferability, and strengthening ecosystem. So it includes all the capacity building activities and support the regional and national ecosystems. It started in 2023, so we are almost at the end of our 2nd year. We also managed to survive the European Commission review at month 18. So these are the main main activities that we have managed to carry out. Under Pillar 0, of course, the governance and management, we established the governance of the partnership, which is quite complex. But it's important that we appointed the advisory board, the national bureau groups, because we also need to have advisory boards at the national and regional level that supports the development of the partnership, and also the ambassador network. And I will talk about the ambassador network in a few minutes. In terms of, in the Pillar 1, the science into policy, where package 4 and 5 work together to launch a survey to detect, actually, it's a survey to identify what are at the moment the health priorities, and also what are the tools for translating evidence into policy that member states and regional authorities are actually using. And where package 4 also developed the framework for the best practice assessment and transferability. And I will talk a little bit about that later. Pillar 2, of course, managed to launch the Joint Transnational Call 2023 on health care of the future, which was focused a lot on integrated care. So most of the projects that we funded are about integrated care. The Joint Transnational Call 2024 was on innovative to prevent, and we have just launched the Joint Transnational Call 2025. And in the Pillar 3, boosting health and care systems, we worked a lot to define what is an ecosystem-wide approach, and in identifying what is our strategy to support the ecosystems in health and care. And we are currently working to launch the THCS Knowledge Hub. But when we did all of this, we were aware that we don't have to start from the scratch in doing everything. There is a lot ongoing. There is a lot that we need to take on board. And that's why I need to develop the synergies. We have already said a lot of times why we need synergies, because we need to overcome common challenges. I mean, we have, for example, a strong relationship with other European partnership to understand what are the common challenges that we have and how we can overcome them. We need to avoid duplication and we needed to deliver joint results, for example. And we need to leverage the results of THCS, but also we can leverage the results of other initiatives. And we also need to leverage the results of the projects funded by the Transforming Health and Care System Partnership. How we worked to develop the synergies. We started building our ambassador network. The ambassadors are those people that are actually appointed by other initiatives that wants to be linked with the European Partnership on Transforming Health and Care Systems. And they will be asked to provide advice and contribution to the update of the strategic research and innovation agenda, as well as contributing to provide advice when we develop yearly the annual work programs. And they can also contribute to disseminate results. They can share initiative. We can also organize together initiatives, and we will see that we can really work together in producing common results. In order to develop the ambassador network, we started mapping all the initiatives that could involve, and we started with the first list of 51 initiatives that we have contacted. We have not received all the replies, so maybe some of you also received the request to be appointed in the ambassador network, but you didn't reply. We managed to receive feedbacks from half of them, more or less. And but of course, the ambassador network is always open to, I would say, newcomers, because new initiatives are yearly funded, and of course, we may have missed something. We have opened a questionnaire online, a survey. Any initiatives that want to be linked to the THCS can participate, either contacting us or also by filling in the survey. The survey is also meant to try to understand what are the main interests of each initiative and try to understand what is the strategy to liaise and to link with us. But of course, one of our main focus, of course, is to try to link the project that we have funded with other initiatives. So the projects that we have funded at the moment are coming from the Joint Translational Call 2023, which was the Healthcare of the Future. We have appointed 28 projects that we have awarded 28 projects that are just starting. And the goal of the call was to identify, develop, and implement innovative solutions that can inform decision-making and optimize the delivery of health and care services across different settings. We had two main aims. The first aim was to provide the necessary knowledge to build the health and care of the future, and to support the implementation of innovative solutions at a larger scale. In terms of type of projects, the research areas that the projects were addressing was the health policies and system research, the health technology research, and social and economic research. Of course, maybe you don't see very well these numbers, but we will share the slides. And these are also part of our deliverable on the impact assessment of the call. And in terms of research types, we had implementation research. So projects were focused on implementation research, applied research, demonstrator projects, proof of concept, translational research, and we had also 3 projects on basic research, but most of them were actually providing implementation research. In terms of clinical and health needs, most of them were focused on chronic disease and also on neurology and aging. And most of them were focusing on treatment. And that's why also the call of the following year, the 2024, was on the other side addressing the topic of the prevention. So JTC 2024 was focused on innovate to prevent, personalized prevention in health and care services. The evaluation has just concluded, but I cannot disclose the results. So I cannot tell at the moment how many projects we have funded. And finally, the Joint Translational Call 2025 has just been, the pre-announcement has just been published last week. And it will be focused on better care closer to home, enhancing primary and community of care. And this is why in the next years, in addition to integrated care, of course, one of our two main areas on which we will want to build synergies are, of course, prevention and primary care. In terms of synergies that we are trying to implement to produce joint results, actually, as I said, our package 4 in this first 2 years has worked in developing the framework for support, transferability, and implementation of practices in health and care systems, which is deliverable 4.4 and is public available on our website. In order to develop the framework, the first step was to review all the methodological frameworks already available that were supporting transferability and implementation of practices in health and care systems. After the review, we developed the framework, which is a theoretical framework, and which is providing 3 main tasks. And for each task, we have tried to develop and describe what are the different steps to be taken. The 3 tasks are aligning and organizing development activity, adapting a solution developed elsewhere, and implement the solution. But of course, I mean, developing the framework, which is very theoretical, is not enough. So we have launched, for example, first of all, a survey, which is still open. Maybe we will prolong on the basis of the results that we will have collected at the end of October. The idea is to try to understand if the framework is actually applicable to existing best practices and pilots. The idea is to test and finalize the framework, and then in the next years to try to develop practical tools to implement it, because at the moment it's still very theoretical. In the work that we have done to develop the framework, we have met JACARDI. And we've seen that we had developed very, I would say, complementary tool with the deliverable 5.1 of JACARDI, which is the methodological framework for support pilot test, pilot design, preparation, implementation, monitoring, reporting, and assessment. And what we can do now, so we have discovered that we really need to work together. The 2 tools are, I would say, complementary. The THCS framework is focused on the transferability and is still at the moment very theoretical. And on the other side, JACARDI has a very strong dimension that we have not at the moment included, I would say, very well in our framework, which is the dimension of the equity and diversity, and is really focused on the implementation side, so on what actually other joint action and other initiatives have done. That's why THCS is also reviewing the methodology developed by JACARDI, and we will do the vice versa. So JACARDI will contribute to our deliverable. And the idea in the future, if this actually synergy will work, is to develop the gold standard, the methodology for best practice implementation and transferability. So in the future, no other joint action will have a work package on develop the methodology for best practice and pilot implementation, but they will start from what we have reached at the moment. Just to conclude, the synergy is a long journey. Our next appointment is the annual conference that will take place on the 28th and 29th November in Brussels. We have dedicated session to present the project that we have funded under the Joint Transnational Call 2023 on integrated care, and also a specific section on synergies. So you are more than welcome to join our annual conference in Brussels. And that's it.
Thanks a lot, Laura, for this very detailed presentation, in particular about synergies. We are a bit late also due to not only to my chairmanship as usual. You should find another chair if you want to respect the time. But also we started a bit late, so I guess we have a time for a couple of questions from the audience. I have a comment that I already, since I repeat myself as all the old people do, I already told this during your assembly last year that there is also a similar framework for good practices implementation managed by DG Santé. They are very jealous of this and they are managing with GRC. So if you want really to step up to become a standard, you have to find a compromise with them. Otherwise, it will be very difficult to put it in an institutional frame. I don't say which in my mind is done better, but I keep it for me. But politically speaking, I think you have to discuss with them how to. They have partially different objectives, how to say that. But clearly, we cannot survive with 100 frameworks. So quite good news that at least these two big projects are managing to do that things together, because it's key that at least those two communities agree on a number of things. There is a question over there. An old friend, back again.
Hi, it's Ilka from National Institute of Public Health, Slovenia. So I would just like to assure and contribute to what you just said about the best practice portal at the European Commission. The JACARDI 5.1 framework already includes all the elements that should be included to apply for the evaluation and assessment at the European Best Practice Portal. We acknowledge the potentials of different views, but we also know that the rules change, so maybe together we can work to a common agreement for the portal, for the THCS project, and of course for JACARDI that does the work and the field now. So yeah, we try to think of that to the best practice portal approach. Thank you.
May I just confirm that in the review of that the THS did for the development of the framework for the transferability, we included, of course, the best practice portal. It was our first reference tool that we have checked. We have included, of course, all the dimensions, and we started from there.
Hello, my name is Inji. I'm from the Ministry of Health in Luxembourg. Thank you so much, Patricia, for your presentation on the JACARDI project. My question is related to the context analysis, because this is very important in every country. So I believe that there will be a report at the end where we have all the analysis and the data. Are you intending to do a kind of work in country, like you support the country in changing policies or strategies based on the data that they give? Because the report is a kind of the general report, but each country, each context is not the same.
Thank you so much for the question. This is really an ambitious issue that you raise, and we plan to do a workshop where we can present and discuss with all the countries that contributed the survey, but also other countries in the European region, and that will be really a good opportunity for initial discussion on what is next. That could be a next step. And I don't know if may I ask Graziano on there if you want to complement.
That the panel was only of women, and now
No, it is.
we can't.
So, thank you very much for the questions. For the question, yes, I mean this exercise is sort of mapping of the situation across different countries. We are expecting to see huge variability. Also, a huge limitation of this exercise relates to the fact that we are assessing national situation, but even within individual countries, there may be a huge variability across regions. This exercise will be necessary for us to also drive the activities of pilots, of the 142 pilots in JACARDI. So somehow this will be necessary to build their activity and their intervention. And also at the end of the game, at the end of JACARDI, we are planning to define roadmaps for scaling up. So not exactly changing policy, which is a really ambitious outcome, but at least at the end of the project, 3 years from now, we would like really to define roadmaps from scaling up country by country, meaning that we may want to suggest, based on this mapping, based on the pilot implementations that we have done, possible ways for improving the situation nationally. So not exactly what you meant, but I mean, we are trying to do our best also to inform policy. Yeah.
Any? I think we have time only for one last question, if any. Yes, over there.
Hi, everyone. I just have a question about the conference in Brussels that was mentioned on the last slide. Like, who can participate and what is it about? Is it just about synergies between JACARDI and THCS or between a broader range of joint actions?
No, it's the annual conference of THCS. It's open to everybody, so it's an open event. There will be different sessions. Just one session will be on synergies. One session will be to present the project funded by the JTC. But then we have other two sessions. One is about how to support the development of ecosystems in health and care. And one session is specifically on how to support the translation of research into policy. We will circulate the. There will also be an online connection. We will circulate the final agenda soon. So at the moment, on LinkedIn and on the website, you just find the save the date.
In social link, so account, so I encourage you to register and to the THCS various channels, so you can be informed of anything. There are a lot of things. So once again, I need artificial intelligence to take care of all the events that are happening in the project. Okay, looks like we have done an excellent first session, and maybe we have to cut a bit the coffee break, or to come back at least in maybe 10 minutes instead than 15, if you are allowed. And so let's get back to for 10 minutes. Okay. Thank you very much again to our colleagues online, and I leave to Graziano for the next meeting.
From different programs, both from Horizon and from EU4Health programs. But before starting the discussion, I'm asking the project representatives to briefly introduce themselves and their projects, just a few words. Please, let's start from the right.
Thank you very much, Graciano. Congratulations for this fantastic organization. I'm Marta Pisano. I'm a representative Care for Diabetes project. We are very happy to be here. Care for Diabetes project is a joint action that helps to replicate one best practice based in diabetes 2 now in 32 different countries around Europe. So nice to meet you too. Thank you.
Thank you very much, Marta. Please.
Yeah, thank you very much for the invitation. My name is Bastiaan Gedan. I'm a clinical academic and a professor of medicine based in the Netherlands. And I'm the coordinator of Melissa, which is a project which is developing an AI-driven mobile application for people with diabetes using insulin.
Thank you very much, Bastiaan. Please.
Hello. Hello. I'm Apostos Vantarakis. I'm a professor in public health in medical school in Greece. Sorry for that. I'm representing Health for EU Kids Joint Action. I'm really happy to be here and thank you for the invitation.
Thank you. Please, Linda.
Hello, everybody. My name is Linda Granlund. I'm the project coordinator for Joint Action Prevent NCD, which is an enormous joint action with 25 countries and 95.5 million euros in budget. And our aim is to reduce the burden of cancer and other NCDs and their common risk factors. We have a chair here, but it's rather low. I can move into it, but then you don't see me. Okay. Thank you.
Thank you, Linda. Please. Briefly introduce yourself and the project you are coordinating. Yes.
Good afternoon. My name is Yannis Manios. I'm a professor in the Department of Nutrition and Dietetics at Harkopoulos University in Athens, and I'm coordinating Dizzy Care for You. It's a project aiming to prevent and treat diabetes and hypertension in high-risk families in certain European countries.
Thank you, Yannis. Anna?
Yes, hello. My name is Ana Maria Carriazo. I'm a public health doctor, and I work at the Regional Ministry of Health of Andalusia. And from there, we are coordinating together with the Andalusian Health Service, the joint action CIRSE on transferring of best practices in primary care, which will focus on transferring 6 best practices already selected into 42 implementing sites. And we are in the middle of the project.
Thank you, Anna. Apologies from Anne Fulando from the JACARDI project. She fortunately could not make it, but she will be with us tomorrow. So before starting the discussion, the panel discussion, I have a very brief presentation that wants to make a point on what we are doing and what may be the common synergies among this project. So, you know, well, we have been talking about the JACARDI project all day long, so I will make it very short. As you have already heard, JACARDI is very much focused on the patient journey, meaning focusing on different steps and different, okay, this is better probably?
Don't know. So it's focused on different steps and different of care with a specific focus on cardiovascular disease and diabetes. So we're focusing on primary, secondary, tertiary prevention. So moving from health literacy to screening of high-risk population, integrated care, self-management, labor participation with specific umbrella of health equity and data availability. So we moved from this framework of JACARDI, and we tried to understand what the other projects that are here represented today were doing and how we can find synergies with these projects. So we share with the persons, with the coordinators, the person that you see here on the podium, a survey in which we were trying to understand the characteristics of these projects, the inclusion of integrated care, how this was covered, the equity lens. You have heard this morning that equity is really a great focus of JACARDI, and we think it should be considered in any project that is focusing on integrated care. And finally, policy and interventions. So we have shared with this project this survey, and I'm going to briefly present you the results of this survey. So first of all, the timeline. because we think that if we really want to build synergies, we need to have common or overlapping timeline. And as you see, for most of this project, with the only exception of JACARDI that ended in 2023, there's a substantial overlap and alignment in timeline. So this means that we can really work together and align our activity, not only on a methodological and thematical point of view, but also with a temporal perspective. Second issue, we try to understand the topics these projects were focusing on. So you see that some projects are focusing specifically on diabetes, Melissa and Care for Diabetes, some others on cardiovascular disease and diabetes, some others generally only on non-communicable diseases. But when we ask about possible links among them, we found that there were several links among these projects. They were somehow already communicating with each other. And also not only among them, but also with other projects that are not part of this panel today, like the Mentor Project, Scirocco, and other activities. So it's important to see that partially some synergies are already ongoing, and most of these projects are already in connection each other. Third aspect, the integrated care aspect. So we thought, okay, let's see from an integrated care perspective, what are the synergies among these projects? And then we ask ourselves, okay, but what is integrated care? What are we referring to when we're speaking of integrated care? And we found this definition that very much aligns with our patient journey somehow. Because integrated care is defined as health services that are managed and delivered so that people receive a continuum of health promotion, disease prevention, diagnosis, treatment, disease management, rehabilitation, and palliative care services, coordinated across the different levels and sites of care, within and beyond the health sector, and according to their needs throughout the life course. So again, this definition very much aligns with our patient journey. And so we try to understand from the projects that are here represented also which areas of this definition were most targeted. And the two big areas were health promotion and health system transformation. And we tried to understand basically which projects were focusing on one or the other area. This may seem very complex, but it's not. It simply tells us there are some projects that are very much focused on health promotion, so somehow primary prevention, some other on secondary prevention, some other on tertiary prevention. But there's again some overlap among all these projects, meaning that we really can work together and find synergies in the different activities that are ongoing. Other relevant aspect we try to understand among these projects is how much they're focused on implementation, intervention, and how much on policy. As an example, in JACARDI, you have heard we have a good, very really relevant part of implementation with 142 pilots, but we also have a policy part in which we want to drive somehow a change and propose a roadmap for scaling up. So we ask exactly to this project, so are you focusing only on policy or intervention, only on intervention? So this is more or less the map where all projects are focusing on interventions, but some of them also on policy. And in addition, we ask these projects, okay, but which are the products of your project that may be available in order to be shared with others or can inspire or be used in other projects. And as you can see, the answer we got most often was digital tools or platform that are made available by different projects, but also methodology, not only JACARDI, but also CIRSE and joint action on non-communicable diseases are focusing on these aspects. So again, there is definitely a room for exchange and synergy also in this area. Last, and then I will close, a big box on equity, because as I said at the beginning, also equity is a relevant part of JACARDI, but also of all these projects, and I think should be targeted and considered in all the future European activities and consider a possible area for synergies. Well, when we talk about equity, we found that in some projects, equity was a cross-cutting issue. In some others, like in JACARDI, we developed a methodology that specifically took into consideration equity and diversity, meaning every pilot in JACARDI must, by methodology, consider these aspects in their implementation. And also in other projects, equity was considered as a cross-sectional factor in addressing population in vulnerable situation. So also equity is another aspect on which we can discuss and find synergies. So having done this very brief introduction, it's now time for a discussion among panel members. So we have learned from this survey that there's an alignment on timeline and disease of many of our projects, at least the projects that are represented here today. There are targets of implementation of interventions, but also policy perspective from many of these projects. There's a prioritization of patient-centered care, digital solutions, tools, platforms, methodology, and also the equity lens is something that is shared among most of these projects and activities. So from this, there were some questions that raised that I would like to address to the panel members that are exactly focusing on these aspects and that were shared with you earlier. So I assume you must be prepared on these questions. And I will now leave the floor to panelists going to some questions. The first of which is how can we first foster future synergies across health initiatives to achieve greater collective impact? I mean, meeting together is probably a very first step for doing so, but you may have other ideas and solutions on how to further foster our synergies. So the floor is yours. I know who wants to address first this question and wants to answer. Anna, please.
Thank you, Graziano. I will focus on the methodology issue because we have learned that in the previous session that both the Partnership of Transforming Health and Care Systems is focusing on methodology and JACARDI run into the methodology. JCare had a methodology. CIRCE had to develop a methodology as well. And I was wondering how we can bring them together or align them in order to, because it was mentioned before, how can we benefit of working of this maybe theoretical methodology into a practical construction and with a focus on implementation and sustainability for the rest. I don't have the answer, but I throw the glove because I think it's a very important thing not to repeat similar conceptual frameworks that we have already. I was revising the methodology from Transforming Health and Care, and I found it very interesting, considering the different steps. And I would like to encourage this common point of synergies and interaction. It was mentioned also at the beginning by the introductory remarks from DG Santé and HaDEA director, and I think that is very important. And we are very willing to participate in this exchange of methodologies and how to strengthen the way of the implementation part, transferring and implementation that is very complicated sometimes.
Thank you, Anna. Linda, please.
Thank you. And referring to what Marina Sanchez said earlier today, she talked about synergies by design and synergies by implementation. And I want to focus on the planning part of these projects because we have some huge projects here, and I think it's very important to have a good cooperation and dialogue between the different projects in the planning period, so we can look at the interface between the projects and make sure that we are not overlapping but work together on the important issues in all the projects. So I think that is something that we can do even better in the future before we start the real work to look into what are the different aspects in the different projects and how can they together solve the overall goals that we have. Thank you.
Please.
Okay. First of all, I believe that these kind of meetings are quite important for these synergies. In fact, most of the people here, I didn't know them. So it's quite an opportunity for us to start working together. Although in our project, for example, we have already started cooperation with big organizations, for example, OECD, for example. So it would be, to my opinion, to foster future synergies, we need to focus the one part which is the methodology, as exactly you say, that because we share common methodologies in some cases or complementary methodologies. So I can use some methodology from other work packages that they have worked already. And the second very important part is the target group that we focus. So if we have common target groups, it would be nice to have it with a unified way. We are focusing the same thing. What is prevention? Prevention for mainly NCDs. So we need to say more or less the same things. We cannot be controversial to each other. So the meaning from the European Union is one, prevent NCDs. So we all need to focus on that with more or less the same way. So thank you.
Thank you. The question is fantastic because we asked for synergies, but also for collective impact. So I need to put one extra element that is achieve social change. And some topics that we need to generate value, setting sustainable goals, define magnitude and scope, design synergies, plan in advance, involve other entities, communication, the result, and of course, to have a policy approach with methodology, of course. Thank you.
Is there any other comments?
Yes, I think I agree with what everything has been said already, but I think so most of the projects are already halfway. So it would have been great to have this meeting earlier. And I was wondering whether new projects coming on would be able to sort of integrate with this kind of topic so that the experience that we have today, that we can pass it on to future projects.
Thank you. Yanis, you want to comment as well? Yeah, great.
Since everybody spoke, maybe I have to say a couple of words. But I agree with the other colleagues, and I would like to congratulate the organizer for giving us the opportunity to be here together, not only for exchanging information on the project and learn from each other, but also, I mean, there's a colleague here on my right who is from Greece, and I didn't know before. Nice meeting you. So that brings opportunity for collaboration, and it would be nice if we have some time to exchange some of the learnings and methods we already applied, which might inspire some of the discussion for the next 30 minutes, whatever.
Please, please. After you.
Can I also give some examples from how we are doing it? And then I want to bring up some examples from the collaboration between JACARDI and HaDEA Prevent NCD, because there we have created what we call sustainability coordination body, where we have the coordinators and the people from the work package 2 communication and work package 4 sustainability leaders together to plan how can we coordinate and implement these things together. And also another group just for the communication people in both joint actions to talk about what and coordinate the messages to the key stakeholders to align up and not or talk about the same things as you brought up here, because we are all talking about prevention and the same thing. So we have to have the same things that we are saying. Thank you.
Yeah. Small comment. I have an experience on Horizon about making clusters. So I believe making clusters is really, really amazing because we join together several projects and we have really good outcomes from the cluster, not from the project itself. So in my opinion, it could be nice to have clusters between these kind of projects. So.
Great. So to sum up, I would say that really these kind of meetings are extremely, extremely helpful. I would say that nobody has said that, but the support of HaDEA in organizing these meetings is absolutely necessary for us, because we are not really aware of all the projects that are ongoing, and their input in doing this is absolutely necessary. I mean, with Prevent NCDs, we are twins somehow, because we are two projects that were born at the same time, not very similar, but in structure and organization. So it was easy to have interaction, and we had specifically a task in the joint action that was focusing on interaction with Prevent NCDs. But overall, I think that is extremely important to have this exchange. HaDEA, we may ask HaDEA, I think it's also their own interest, as Marina Zanchi has shown this morning, to support these activities. We will for sure have another meeting by the end of the project. The idea of creating clusters of activities may be a very good one to support the activities, understand who is working on methodology and who on what else. So, but it seems that each of us is very open to collaboration and to create something that is joined together, that is done together, in order also to give more strength to what we are doing. You want to add something, Anna? Yeah, and we can move to the second.
Yes, I would like to stress what Linda mentioned before about the sustainability and the dissemination activities that we could share. Particularly the way, because I don't know, JACARDI, how they are going to build the practices to be transferred. We already had them previously selected from, it's the same of Care for Diabetes, from the best practice portal. Maybe they are not all the ones that are in place, for sure, they are not all that are in place throughout Europe and that could be implemented. So, and within CIRCE, we are working in the development of, thanks to the work of the team in sustainability, on an observatory. Focus on primary care, of course, because the topic of our joint actions in primary care, but is the place to implement a lot of prevention and health promotion activities, and to strengthen the collaboration and to break in the silos that between all the different levels of care. So I don't know how to mobilize ourselves in doing so, together with JACARDI, of course, but thank you again, Graciano, for merging us all together. And I'm looking, because we are starting to look beyond the end of the joint action we are involved. So it's very important to keep them working. And sometimes the time that we have for the implementation and evaluation, assessment of the implementation within the time frame of the joint action is not enough. So we need to look for beyond the end of the joint actions.
And this perfectly opens to the second question that asks on strategies that we can adopt to maximize the long-term impact of our interventions while ensuring sustainability. So, Marta, please.
Yes, I think sustainability, when you talk about sustainability, we need to think in resources, in the territory, in the community, resources in our teams. No, we need to think about health economic analysis, just to try to prove if our intervention are effective and effectiveness. And we need to try to incorporate always methodologies, quality methodologies like PDCA cycle or other methodologies. No, so in care for diabetes, for example, we incorporate OECD, that is in a European project itself, that we can help all of us to improve and to prove how efficient are our project. No, I think sustainability need to combine three elements. Thank you.
Thank you, Marta.
You or me?
Can I? You can choose the order you prefer.
Thank you. So I think this is particularly an area where we can learn from each other, because sustainability is a topic that is important for everyone and for every project. And I think it's also an area where you make a lot of mistakes, and you can only do it once and then the time is gone. So this is a particular area where we can sort of build together to be sustainable for everyone, so that we sort of build a big case so that it has more impact for everyone.
Thank you.
I find it the most difficult question of the four, because I'm really concerned with both of them, impact of intervention and sustainability. Why? We are talking about European countries. The sustainability is quite different between the countries. So some countries can find it easy to sustain the results of the projects, of any project. Some kinds can be finished with the project at the end of the project and stop sustaining anything. So I'm not quite sure that we can have an easy answer to that. And even strategies should be completely different to different countries participating in the project. North European countries, South European countries, they have different behavior about the project as well. So to my opinion, in order to sustain the results of the project, you need to insist on them. I mean, as HaDEA or European Union, wherever, to ask results after the end of the project, that is, as it was said, sustainability. And we are talking about projects that they're starting as a theoretical research or even some interventions, the small pilot in the community, and we ask them after the end of the project to go to the community. So that needs resources. How the country will find the resources to do sustainable work after that. I've done several projects in the past where they finished when they finished. So it was really disappointing for us as researchers or professors. So I think we need to insist consistently on that. We need to have impact of our interventions. That's the first thing. And as higher is the impact, as it would be, more possible to have sustainability, because the countries would like to see impacts in any interventions. And then following these interventions, we can persuade the politicians that we need to sustain the project, we need to sustain the results of this. So to my opinion, the strategy could be focus on the best impact as we can in the project. And after that, to the HaDEA to push a little bit the politicians about in each country through the European Union to use the results of any projects, because they are spending a lot of money. So we need to see them, the results to be sustained.
Thank you. Linda?
Yes, I want to focus on the influence on the EU level, of course, but also at the same time have the focus on the national authorities in the countries involved in the project. And just to say that when we said yes to coordinate this huge joint action from the Norwegian side, we at the same time started up a national project to implement the relevant interventions in Norway at the same time as we are running the joint action. Because I don't think that when focusing only on the EU level, we won't have the effect at the national level. So we have to do both things at the same time. And but I know that that's difficult for many countries, but to try to do that and to support the countries by doing that.
Right. I'm stressed. I see everybody has notes in front of them, and
he cannot copy yours.
No, not very helpful. Well, maybe I need to give you, because DigiCare4You project is well ahead from the other project, and we're halfway through. So maybe it's good to share with you some of the key learnings so far. In previous European projects, when we try to prevent or treat diabetes and hypertension and cardiovascular risk factors, we realized that targeting on individual is not very effective. So in DigiCare4You, we're targeting families. And that's very much powerful, because especially for the vulnerable populations and low socioeconomic groups, they don't have a motivation for themselves, but they might have a motivation for their kids. So we're not approaching individuals, but we're approaching families. And we are following WHO approach on people-centered care. So we try to strengthen health literacy, improve health literacy and self-care, and try to explain to those parents that what they're doing is not they're doing for themselves, but they're doing for their kids. So the family approach seems to have a lot of important impact so far. Now, how can we ensure sustainability? Well, in our case, we are working with stakeholders. So we're bringing together, since we're talking families, we're bringing together families, schools, neighborhood, and primary healthcare system. So we are breaking alliances and have stakeholders involved from all those sectors to work together for the benefit of the families, especially the most vulnerable ones. And by using existing procedures, which I will explain on the equity question below, so I will not talk about procedures now on screening of the populations, but by delivering intervention both by the teachers, by the healthcare providers at the community and neighborhood level, using existing resources and existing human resources, by upskilling their skills by digital tools, minimize the burden for the teachers and the healthcare providers, increasing compliance of the beneficiaries on the program by using digital tools, minimizing the health visits to the healthcare system, so less burden for the healthcare system, less burden for the beneficiaries, and apply digital procedure to ensure real-time monitoring the whole process, then we hope we can improve sustainability, because it's low cost, existing human resources, digital tools to minimize burden and cost effectiveness, and delivering a system which can sustain after the end of the project. So we try to build procedures and tools which will be still in place after the project has finished. And that's more likely, in my mind, I think will improve sustainability. Well, the first results so far are very promising, and I would love to share with you soon.
Thank you. Anna?
Yeah, besides what I mentioned before, I think that what we included in one of the work packages in CHIRCHE is the one on training and having training program to explain better, and I think it's linking with Janice, right? What Janice said regarding this involvement of different stakeholders. So you have the correct information to be transferred from the different people actually learning now, and to be able to sustain that in the future, because they can train trainers. And this the focus and the vision that we have produced within CIRCE when it's still in process. So this way of additional tools, not only meeting, but also training tools, and could tailor more or less made, because there are 6 best practices and they're very different among each other, to have a common understanding of broader activities, but then specifically on each one of them. So these training aspects and showing how to do things afterwards for the sustainability is important. And also the synergies, and has been mentioned before with OECD, but also with WHO, they have a strong focus in the case of primary care on primary care. Let's talk about primary care and strengthening primary care as a way of making healthcare systems more sustainable in the future. And I personally totally agree with that vision. So I think that's this enlarging the synergies beyond not only the EU member states and EFTA states, but also beyond EU, WHO, European region, and so on.
So based on the discussion, I understand there are 2 relevant aspects. One relates to the effectiveness and cost effectiveness of what we are proposing. I mean, if the intervention we are proposing are effective, then maybe more likely that they are accepted, that they can become the standard, and people may want to receive such an approach. On the other side, as Apostolos was underlying, it's also necessary somehow top-down approach. I mean, a political intervention or support of this kind of interventions or new practices that may really foster their adoption at the national level. So I see, at least from the discussion, these 2 big parts of the interventions that are needed to support sustainability. And so now I will move to the third question that relates to how can we enhance the sharing and integration of tools and methodologies across projects to streamline efforts and improve outcomes. As I showed you from the survey, it came clear that most of your projects are developing tools, digital tools, platforms, and also methodologies that can be available for future projects and for sharing. So how can we make this possible, this sharing, and which steps should we take to do so? Who is starting?
get your opinion.
All these questions are really very interesting, but this one is more practical, no? I think at home, I try to imagine that in our projects, we have a specific work package together with our projects, no? Because usually you think about this when ended the project, no? Because we have a lot of work during our projects, no? So probably put a common work package with two, 3 projects who have the same way or the same topic will be innovative. Probably we have money and people and hours to share our methodologies.
Thank you.
Yeah, I think this is a difficult question. I think, so from our experience in our project, we have a very active patient advisory committee. I'm not sure whether that is also applicable to the other projects. So we interact with them. It's a group of 6 or 7 people with liver disease, and we discuss with them our project and also change the project in their direction if they think that is applicable. We also map health literacy and health numeracy, which is particularly important for people with diabetes who need to calculate the dose of insulin every day. So numeracy is important, which is a topic that's normally not addressed. And so that the tool that we develop will align with the goals and needs of people with liver disease, people with diabetes, and that people with low health literacy can also use it. And I think it would perhaps be something that we can kind of share this experience with other projects where if they also have these kind of patient groups to sort of interact and see whether the experience they have or what we develop sort of does meet with their expectations.
Thank you. I believe that the cluster is really important for sharing methodologies because cluster means that all the projects will be together, some researchers will be together so they can speak the same language and they can share the different methodologies and find common places. Also, it could be an idea to have a repository in HaDEA of methodology. So I believe that this is really important because it would be fun. It would be fun for me to look around, to look about methods that they are using, and it would be really, really, really important, especially at the start, the first year of a project, because then you need to understand a lot of things. You don't only need to find publications, but there are some methodologies that they have not published. So if you have a repository, it would be really helpful, to my opinion.
To bring up some examples here on the practical side on how to do this, for example, to arrange meetings together regarding some of the tools and methodologies is one example. And for example, for JACARDI and HaDEA Prevent NCD, we had meetings together on the monitoring systems, also together with WHO. That was a very fruitful first meeting, and we agreed on doing this further also in the project to discuss these things together. And also in HaDEA Prevent NCD, we also have started up now we will start up tomorrow having webinars and to share how are we working with different aspects of the project. And the first webinar is tomorrow on commercial determinants of health, and we will have such webinars once a month. And then it's nice to share with other projects and look into each other projects and the different things they are discussing.
I agree with the colleagues that exchanging knowledge and information even before publishing, because publishing will take a long time from now. So the earlier we share information will be great. And then we can have integrated tools and methodologies that could work throughout different countries. And I can give you again an example, if I'm allowed to, from DigiCare4You, which is a project implemented both in low-income countries in Europe and high-income countries, which are very different, as you can imagine. However, we wanted to have comparable results using similar procedures, but adapted to the local situation. So again, example, in previous projects, when we approach the communities and invite people to join for any preventive actions for preventing NCDs, we always see the same patterns. The most health-aware individuals and the most educated individuals join. Those that we call hard to reach, they're indeed hard to reach, and they don't join. And that creates a difference on equity, because we keep intervening with those that are more health conscious and attend, while leaving behind those which are less health conscious and they don't attend. So we thought, let's build on existing procedures in each country, like for example in Greece, in order to have your child register in 1st grade, 4th grade, 6th grade, etc., it needs to go through a brief medical checkup for health monitoring growth. So we built on this compulsory procedure and to approach all families in the community, starting from the most low socioeconomic regions. So via this procedure, we come in contact with everybody and inform them about the benefits of just spending some minutes with us. So everybody is approached, and this is what we do in Greece. Now, in other countries like Albania and Bulgaria, the same approach for monitoring children's growth goes through the school. So same procedure, find a compulsory procedure in a local situation, follow it, and screen or approach everybody. And that gave us very important results, because the participants, for the first time ever in projects we had, was in those specific areas, including Greece, 60% of those participants were less educated people, having only attended compulsory education, compared to 40% with higher education. We never get these results from any other procedures. By this procedure, we managed to have a higher percentage of population with lower education, including also immigrants and minorities. So following similar methodologies and integrating tools, and we can learn from each other, we can pick up ideas and implement them on a European level.
Well, I will suggest something very concrete, to repeat this Synergies meeting once in a while, because I think we can learn from each other. And also I will take the proposition by Apostolos regarding this repository of material, such as Janusz commented on the success of the way of approaching things. So I will go back to HaDEA and ask them, because we are focusing on the work we have within our joint actions, and sometimes we don't think of connecting with the other joint actions. So this is, I think, and probably these joint actions on national focal points, both for the Health EU4Health program or the Horizon Europe, they could strengthen this way of getting together and finding synergies and building the repository for the people that will come afterwards, because there will be more to come when we finish, and to not start again from scratch. There is a lot of things already done within our projects, and probably we don't have that space foreseen in the ones that are already in place, but to think about that for the future calls and the future work to be done, and repeat these meetings as well, Graziano, in Rome.
You have to ask HaDEA. I mean, so I thank you for your feedbacks. I also want to put something from the JACARDI perspective, taking and moving from what you said. And two aspects are I believe, relevant. First of all, the repository. I mean, we have a repository for good promising practices. So that's already a start that can help us to identify people or practices that have done well, that can be replicated or from which we can take something. This may imply the use of tools or methodologies and so on, but really I completely agree that the availability of repositories of what we have done of good and promising practices, or also tools and methodologies, may be extremely helpful. The second step I would like to underline that was said by Yannis is the adaptation somehow of what we are doing. I mean, when we are considering a best practice, we cannot take the full package and transfer it from Finland to Greece. Probably that's almost impossible. But we may say, and this is what we are trying to do with JACARDI somehow, okay, let's have a situation analysis, let's see what it's really your situation locally, and see how you can transfer parts of a good practice into your pilot activities. So I think these are two important aspects, having everything available and making possible to adapt what we are proposing, because probably we cannot say you have to do in this way and completely change your behavior in a given situation. Apostolos, you want to add something on this?
It's amazing because you said exactly what we do in Health for EU Kids. I mean, we try.
That's what we're doing in JACARDI.
No,
since we have a synergy there.
The thing is, we are trying to transfer best practice from Finland to Greece. So we need exactly, that's what I am talking about. But the important thing was that we got all the information from the methodology. So we transferred, adapted, like Jan said. I mean, we adapted to Greece. It's completely different. Completely different. If we believe that it's the same, we cannot do the same things. So in order to save money, because we save money, because we know the experience from other people, and then we can use it in a better way. So I think that as fast as possible, we need to have a repository of methods around HaDEA.
So we will bring this message to HaDEA, to Ms. Zanki.
Can I add something on this?
That's why you're here.
I think we all agree. It will help us to choose if, in addition to the methods proposed, if we had also some data on effectiveness and cost effectiveness, because that's also very important, right? Because then we can choose correctly, because if we choose cost-effective procedure, they're more likely to be sustainable, they're more likely to become policies.
Well, I'm not very much into the best practice portal, but I assume that there's an evaluation of these aspects before including a practice in the best practice portal. But yeah, absolutely agree. And this drives us to the last question, so we're almost there. That relates to equity lens. So I think we should consider, I mean, we put a lot of attention on that, to incorporate an equity lens into all interventions and policies to ensure inclusive and fair health solutions. So which are the best ways for doing that? We always start from Marta. Do we want to start from Anna this time? The microphone is here, so it will make it easier.
This is, I mean, I'm particularly in the joint action and transfer of best practices in primary care, doesn't have a specific focus on equity, besides what I think that is the most important one, that primary care is for everybody. So maybe this is enlarging what we are doing with strengthening primary care in the different pilot sites and implementation sites that we are developing, and strengthening the already selected best practices for the future. We think we need to incorporate this equity and considering, because health systems are not the same in the different countries. Some of them are more centralized, some are more decentralized, some of them are based on a beverage model, others on a Bismarckian model. And this equity lens is something that is part of the European added value, I think, that to have everybody on board and leaving no one behind. That is something that we'll listen to and try to incorporate. Probably from the CIRSE joint action point of view will be this view and approach from primary care that is the most important, I mean, first point of care for the people. But I think that
Thank you, Anna.
this has more.
He has many notes, so we are expecting a long speech.
I'm just taking my notes inspired by the colleagues. I'm trying to share with you some information which I think you hopefully you find it useful. So I already mentioned to you that we're using a screening procedure which ensures that we screen everybody Of course, we cannot force everybody to participate. We give them opportunity, we inform them, and hopefully we have them joining. But by using digital tools, as already mentioned, we ensure that we can have a more cost-effective approach, which is very important. However, digital tools, in addition, digital tools also give us the chance for real-time monitoring. What usually happens is during a project, after 6 months or 12 months, we say, well, we failed in ensuring equity, or we fail in being effective. But with real-time monitoring, which means that we have on a weekly basis, we can monitor the participation of the beneficiaries. Are they all joining? Are certain socioeconomic groups staying behind? Are they attending the planned visits? But also monitor the implementers. Are they doing the job properly? So by applying real-time monitoring, we can take corrective actions early before the end of the project and try to ensure equity, try to ensure that everybody is equally benefited from that. That, ideally, based on our plan, will lead us in developing a roadmap for scalability and transferability. So at the end of the project, this is what we envision. So we're measuring effectiveness, cost effectiveness, equity, but also building at the end of the project a roadmap so we can all learn how we can possibly scale up this initiative or part of this initiative at a country level or in other countries in Europe.
Thank you. Linda.
In Prevent NCD, we have one work package focusing specifically on equity, but equity is also a cross-cutting team for all the technical work packages, and we have created what we call a transversal equity group with representatives for all the technical work packages. And when we, for example, are working with the detailed protocols for all the activities and more than or around 100 pilots, we have to use the equity lens to look into how the activities are planned. So it's yeah, when you ask about how we work with it, we work quite a lot with it in Prevent NCD.
Even if I have no notes, I have my mobile, so I can get advice on that. So I need 1 more minute than I expected to speak, okay? So I have my experience in 2 projects. One project is from JACARDI, which is Health Inequalities Project, and of course, Health for EU Kids, which is about child obesity. I believe that it's really difficult to put everything in the same horizontal way to approach the different people, especially not only inside the country, but around Europe. Europe has differences. The best way, to my opinion, is first of all to be honest with what we face in the community. What is the community about? Greece is different than Italy, than Spain, than have different civilization. What I mean different ideas about some things, different education in some cases, different health system. They said the complete different happens to Finland, for example. We discuss it all the time with Finland for health for EU kids. They have different approach. So we need to face the problems that we are going to face during the interventions in our projects. And in order to face them, we need to go to the community. Not only digital, as what Yannis says, but I agree with that, but not only that, we need to go to the schools and face the problems, for example. We do actions, interventions in schools. I have to be honest, I'm really surprised with what I face in several cases between the difference between the schools in the same city. So in order to appoint or do as much as we can, we need, first of all, to admit that we have health inequalities. That's for sure. So based on that, we need to give specific pressure to the local communities, because without the local community, I mean, municipality, for example, you cannot do anything in health inequality. You cannot go from up to down. You cannot go from the government. You need the municipality as well. So then you go to the region, you ask them to help to contribute to that, and then you can do with your government whatever you want. So because health inequality and health inequity goes together with sustainability. Because if you want something to be sustained, you need to work on health inequity.
Otherwise, it will not work, it will not stay. Because the people have other problems. Their problems, for example, is how to live, how to eat, how to educate, for example. So you cannot tell them things that they don't even touch them. So somehow you first go close to them. So for each project, to my opinion, that's my personal opinion, of course, and for our project as well, because we're working in this way, we're going to schools. We have a digital tool, but on the same time, we do intervention inside the schools in order to put them in the same level. And somehow, with some hope, we touch and reduce this health inequity. Thank you very much.
Thank you, Apostolos.
Thank you. So I think our project is very different from the others, as we, in our project, we try to validate a mobile app that can be used by people with diabetes. So I think in terms of equity and being inclusive, it starts, of course, with having a project with people, partners from different cultural backgrounds, different scientific backgrounds. People with lived experiences is an important issue. And you need to define the populations you're developing your tool for, or you're doing your research on, and realize that in the end, you will miss certain parts of the population, right? So you develop something and it will be hopefully be taken up by as many people as possible, but you will always miss people. So I think if you define your population in the beginning and then in the end look which people actually take it up, then you know where your blind spots are. I think that is important. The second thing is what has been said already before is cost effectiveness and particularly cost. So who's going to pay for this digital tool or application that you're developing? Is this the insurance company? Is this the government? Is this people themselves? If that's the case, then it needs to be at a very low cost to be for a lot of people to actually be able to pay it. And of course, it should be effective. So I think these are the main topics to ensure equity.
Thanks. Marta?
I'm very happy to speak the last in the room because I completely agree with my colleagues. I want to read a definition of one of the most great epidemiologists of this century, Michael Marmot, that say if the major determinants of health are social, so must be the remedies. No? So 16 years ago, the World Organization said that working with people with inequities and vulnerabilities as the most effective way to achieve equity. And why not to incorporate the schools, the education, the industry, the injuries, the market of food or tobacco laws or etc. No? So I think I conclude that really we need to work more in integrated care, really integrated care with community, with social, with other sector. Thank you.
Thank you, Marta. So I really thank the panelists for helping us really to discuss several relevant issues. Before closing this session, because we are running out of time, I'm asking you to scan this image for the Mentimeter. We are going to ask you few keywords for future directions on integrated care, on non-communicable diseases. And I know the Wi-Fi is not working very well. I'm sorry because of that, but see if you can access the link. And it's true we are running out of time, but we may have some times for 1 or 2 questions. If anybody wants to raise a question, please stand up and raise your hand. Jelka, can you come in front, Jelka? Please introduce yourself.
Jelka from Slovenia, National Institute of Public Health. So I see that the JACARDI project is not represented here. So now I have the hat of JACARDI. Actually, the first joint action that introduced implementation as the goal was CRODIS Plus, and there was development of the methodology in the hands of Chronic Gune at that time. that was applied and taken over also to the JACARDI that they were actually coordinating. And I'm here speaking mostly for the part of transferability of the practices, because we analyzed really strongly the 4 practices that were suggested by the by the HaDEA to be implemented across 20 countries in jade care. And the process, how to really understand why the good practice is a good practice, is extensive and very human resource consuming. So it's been a lot of work done already in jade care. With respect to the sustainability, because we were leading the sustainability work package there, we designed so-called jade care sustainability framework that can be told in 3 sentences. So the first one is be aligned to already existing policy frameworks and initiatives. For example, the Norwegian example is excellent. So there is already a way how the piloters from Norwegian context will be uptaken to the country. Or in Slovenia, we have national diabetes plan, and for example, pilots that are in place in all these joint actions are actions of our annual diabetes implementation plans already, so they are already implemented. So the second one is the holder of sustainability. It was so nice to hear from you, we should push somebody. Yeah, it doesn't work like that. So you have to make alliances while you are still here. And I don't know if you are aware how important, how much power you have while you are in the joint action. And with the final conferences, all doors close. So think about holders of sustainability. That means generally stakeholders and communication with them. And the third one, how you make yourself useful, is by bringing communication and co-design as a principle and shared values with those who now you believe that should be pushed, but the more you go to the end of the project, you actually need them. And if you need them, make yourself useful for them, and it will bring over. So this approach is also part of the implementation methodology within Care for Diabetes, and involved also in the methodological framework of JACARDI. It is there, it is not called like that because the piloters don't like the PDSA, ABCs and CCs and so on, but it is already there. And yeah, let's have a final, let's have a joint meeting on all the approaches that we have and about all the mistakes that we have had in the past.
Thank you. Thank you very much, Jelka, also for giving us some insights related to JACARDI care. So I'm closing up by thanking, really bringing a great thank you to all the panelists here, because it was really a very helpful discussion. I think, and I'm looking at Benedetta, but I think we should have more of these kind of meetings, because really the exchange, especially face-to-face of activities and of what we are doing is, I think, extremely important to enrich our projects, but also, as Jelka said, to create alliances that may help us to improve the sector of integrated care. So thank you very much. And these are the results of the Mentimeter. You still have some times to vote, but we would like to report this figure in the report that we will be writing related to this meeting. So please include your vote and vote by the Mentimeter. Thank you very much to all the panelists and to you for being here.
Yeah.
So before the cocktail, we still have a session. So we have to decide. First of all, if there is a volunteer for chairing this session, I will be happy to leave the floor. In particular to a woman, because we had 2 chairpersons which were men. So Okay, let's try to be brief. The sense of this last part is to involve our two networks, and you will see also this tomorrow. These two networks that are not the only reference for HaDEA, but certainly the two most relevant for us. So the network of the national focal points of U4Health and the national contact points of Horizon Cluster Health. And so we have asked two colleagues, one national focal point and one national contact points, to provide their own experience about the many things that you have heard today. So please take the floor. Why? Because at the end of the day, we have heard the opinion of the agency, we have heard experiences from project leaders, but my personal opinion is most of this work also involve the national reference persons. So it will not be that easy to figure out this process without thinking to one person or one group. Maybe we will have other places to discuss this. That brings the responsibility to bring all of this to the country. So we could discuss how to do this in several ways, but what we can do today, tomorrow, and in the next month is to understand how to start, at least how to start. So thanks for accepting this invitation. I will start with the national contact points of Cluster Health. First of all, because you are the oldest group of the two, you are the most experienced, and you probably already have these challenges of synergies, because clearly Horizon is much bigger. Now U4Health, it's a relatively big program, but it's quite new. So the synergies is a recent issue, while for Horizon, it was already something that I've been dealing with for them. Please, the floor is yours.
Yeah, thank you very much. And what an honor to be invited to do this wrap up here today. I didn't really know we would be being chaired, so we were actually preparing to chair ourselves. But this is what often happens if the support system comes. Yeah. And yeah, I mean, with this summary, I feel we are going a bit full circle here. We started with the synergies between the programs on a very general level. There has been an event before which addressed synergies on a general level. We've been introduced to synergies between the programs, between the instruments. They were presented so comprehensively by the director of HaDEA, Maria Zanchi, and also we've heard so many in-depth examples today from the cardiovascular spectrum, from the diabetes spectrum, and we will deep dive in another example tomorrow. So this is really, really exciting to hear and to see your perspectives on this. We're here as representatives of the support system. So as I was just so lovely introduced, I'm a national contact point for Cluster Health for Horizon Europe.
I'm Ana Garcia. I'm a project manager of Joint Action NFP4Health. So I represent the Instituto de Salud Carlos III, who is the Spanish national focal point in Spain, and also is a beneficiary of the Joint Action NFP4Health.
Yes, and I mean, to sum up a bit what I've heard, we've heard about the efforts, the budgets, the contents, and let's face it, creating synergies is rewarding and it's enhancing the work that's being done. And it's extending the reach of the work we're doing, but it's also hard. Keeping track of the ongoing initiatives here and there and in your spaces and our spaces, that's almost a full-time job on top of the project work you're doing, right? Policy in itself, that's a good thinking, but that also by itself stays just a good idea. Projects create a lot of results, but those results don't have the same reach as if we're working together. And we've also looked at different ways to cut the cake. As I was listening here today, we've heard, okay, you can cut the cake by the program itself or by what budget you allocate to something. You can also cut the cake by the timeline. How can we bring projects together because they're doing things at the same point in time, but how can they valorize what's been being done before them and so on? So the different examples today have illustrated their efforts to map the synergies and map their ecosystem. And there was a little bit of a notion at some point that this might be a double effort. However, I think it's not, because everybody's bringing a different perspective to the table. And this perspective is actually important because just in the end, with all perspectives on the table, we actually can put a puzzle into place, which will really bring out the quality of everything that is being done. And this is also the case for our respective network projects. So I think, Anna, you have a lot of interesting examples to share.
Yes, so I would like to emphasize that the national focal points and national contact points have an essential role to play in promoting synergies between health-related EU funds, but not only the contact points, also the networks of national contact points or national focal points should promote and support the synergies in EU programs. This is what Joint Action NFP4Health is doing, is the joint action on increasing capacity of national focal points. In the framework of Work Package 5, the joint action has developed different actions to promote and improve synergies between the national focal points and health-related European funding programs. One of the first steps has been to map the interaction between NFP and NCPs at the national level, and in order to identify barriers and also to emerging best practices. So in the specific case of Spain, the national focal point and national contact point of health of Horizon Europe are in close contact and frequently share promotional and training events. The NCP of Health present also the program at our institution in a small group, just to have you can share experience and doubts with her. It is important to emphasize that the two institutions, el Instituto de Salud Carlos III and Fundación Española para la Ciencia y la Tecnología, promote this type of interaction between contact points. So the national institutions in which the contact points are located play a very important role in creating synergies. In this sense, Instituto de Salud Carlos III have started a pilot experience in which we have created a synergy group composed by colleagues working on Horizon Europe Partnership, ERA for Health, EP-PERMED, Transforming Health and Care System, Transcam, also colleagues working on Horizon Europe project as HNN 3.0, the network for NSCPs, UCAIM or GDI, and also the NFP, that is Maria José González de Suso, that wasn't able to come to Rome, but she is connected online, and also the NCP of Infrastructure, and me, that I'm project manager of the Joint Action NFP4Health. So the idea of this synergy group is to understand synergies first at the financial item, no financial synergies, but then we are going to move to exchange experience in activities and action of synergies, like today, no? That to this event we can share this event, the conclusion in this meeting, and this synergy group, and also other meetings of other colleagues. So it is important to have this type of event that allow discussion about synergies, and also in the joint action, another example of workshop is learning by doing labs. That is the Italian coordinator team of the Joint Action NFP4Health that organized this type of events, and was held one in Spain on the topic of cancer very recently. The event was based on active participation in working groups. And in Spain, we choose participants of project manager of Health Research Institute and also researchers with high experience in EU funding. and was a very good experience because it's people can share experience and can have time to share their points of view. So we distributed the brochure designed by HNA 3.0, the one that the network of the NCPs have done.
Yeah, well, speaking of a good use of resources, right? Instead of doing the double work, we're very much using each other's efforts in different ways. And I think those were some beautiful examples. I can add some from the HLN network, where actually, yeah, it's also, as many of you projects actually have been pointing out, there is a big focus on synergies. There's a whole work package around this. There are specific events. For instance, one happening next week, which will bring together the national contact points and the Digital Europe program. So a lot of things going on, and I think we're working closely together, just as you mentioned, both on the national level. I mean, we each know our specific counterpart. That's very true for us in Sweden as well. And just as you mentioned, we also cover the stakeholders in a very complementary way, because we sit in different institutions. We all, I mean, that to be said, of course, the NCP network is the older network, if you weren't to say so. It's been existing for multiple framework programs. I think FP7, if that's correct, or might be even older. That predates me, who's in the game for 6 years now. But that doesn't mean we can't learn from each other. Because even if your network is new, you're covering a different part of the system, which we very much want to involve in the Horizon projects as well, of course. But the Horizon program as such doesn't extend its arm as far into the implementation as the EU4Health program does. So I think in that sense, it's extremely well made as a continuum. Somebody has been mentioning the cancer mission earlier today, and I think there you can really beautifully see how those programs work together. You can see the Horizon funding really boosting the innovation and research part of things, and you can really see the uptake through the actions that are put into place by the EU4Health program. So you can see this really on multiple levels, just as we've been talking through here today, on the program level, on the structural level, how we organize ourselves between the support systems, and also at the project level. So I think, yeah, resource efficiency definitely fulfilled, I would say. We've also earlier heard the DGRTD definition of synergies, and if I relate to our work, I would say compatibility, definitely. From both sides, we want our stakeholders to collaborate, no matter which part of the program they're using. There is really no conflict in being engaged in both programs at different stages, or even by the same organization at the same time. Complementarity, absolutely. I've just mentioned the cancer mission, and you had a couple of examples there as well. And also at the network level, we have complementary knowledge of the two frameworks, and we share this with each other. We share this with the stakeholders, just as you said, at common events, and also by sharing the knowledge between each other. And we cover a different spectrum of agencies and an overlapping group of stakeholders. Coherence was the next criteria. And yeah, I would say so. As we share knowledge of the programs between each other, we are able to share coherent information and support the stakeholders in a complementary way. Good interaction. Yeah, I would say so. If we're just looking at the event today, and if we're also looking at other events we're running together. We've just heard some examples of how NCPs and NFPs work together nationally, internationally. And the last, I think, last criterion was enhancing effects between individual actions. I would say I sure hope so. Time will tell. But I think we're for sure moving into the right direction.
Thank you. You have been able to, in such a short time, to present all what you do, and I think it's fantastic to see that at least 2 countries are doing well. Let's try to put also Italy within, so we make 3, and I'm not sure if Caterina agrees, but we try to do that. Any questions for the colleagues? Does not seem the case, so I take the opportunity to have one question. So, hello, Caterina, do you want to we have heard a lot of things today, and everything seems to work fantastically. And so, I have 2 questions. Why we discover now that this can be fantastic? And the second point, which is always behind any, let's say, not conservative reflection that we could do. If there is such a synergy, why can't we figure out, at least in those countries where this is feasible, probably it's not feasible in the Commission, to have just only one group? Why not? Clearly, the first answer is because political is not feasible, but we are not politicians. So my question is there is a technical, let's say, motivation to keep 2 groups for something that more and more looks like to be, let's say, a different level of the same job, and to a certain extent, it looks to be impossible without the contribution of another group, because it's not just to make synergies. It's the problem that my own job is impossible without having some kind of support and information from your side, but probably from many more. So the question, why shouldn't you do that, my job, or the other way around? In particular, let's think to small countries that clearly do not have 100 persons that can deal with 100 European programs. Regretfully, our Maltese colleagues had some problems today. I hope they will be here tomorrow, but we have met recently in May in Valletta, and they discovered that they were doing this job also for support farmers to do European requests for funding, because they are a small group, but they are small countries, so they are very active also in a number of things that probably will never come to our mind. So clearly, once again, there is a need to adapt to the individual countries, but from a theoretical point of view, why keeping these activities separated in theory, not in the everyday life? I have some ideas, but first of all, I would like to hear your conclusions. And I just want to anticipate that in the next joint action, we will do, first of all, to enforce further this cooperation with Horizon and others, but also to reflect a bit on the sustainability after 2027 on this point. Sorry, it was a bit too long.
Yeah, I can go first. I mean, from the perspective of a small country, actually, Sweden. I think the main benefit, so to say, for us at this point, that there is more than one network, is actually resources. Because nationally, it's much easier to motivate why you should have more than one person. Me as an NCP4Health, I'm one person for the entire country. Thankfully, there is one NFP, because this means actually that we're 2 people doing the work. We also have, of course, the support from everyone who's working in the different partnerships from the financiers side. They're doing their fair share of outreach and work together with us. We also have the SRGs. So in the end, by dividing those roles, we actually make sure we have a workforce to do the job. If you would collapse all this into one, there is a certain risk that there will also be one person. So this is from the perspective of a small country. This is why. It doesn't mean you have to actually separate the work on the ground. I mean, this is not, if you look at it also for Horizon Europe, we have NCP networks for all the different clusters, of course, and we also have them for Pillar 3 and we have them for Pillar 1. And this is extremely important because it ensures that there are enough people to work with every dedicated part. This doesn't mean that we're not working together. We're actually, most of us, sitting at the same agency and doing the job together.
Thank you. Yes, I think also I have the same impression also that in Spain we need this type of resources. So to have one national focal point and one national contact point is important because for the resources. But also in our case, I'm going to talk about Spain. We have different regions. You know that we have different regions, and we have this. It's important to have one reference point. And these are in different ministry. So the national contact point is from the Ministry of Research, and the national focal point is in the Ministry of Health. And so this is clearly separated. So I think this is also another difficult, another barrier. So different ministries that have these roles. But the idea is, even if they are different national contact and national focal point, the networks are the ones that should join together. So I'm pretty sure that this is the way that the networks, HNF 3.0, I have the impression that is our big brother for joint action NFP4Health. It's like they are helping, and it's like our mentoring to how to work as network. And perhaps in the future, we can go to be just one, but I think in this moment, contact point and national focal point is in Spain is we need it. We need the two figures in this moment. Yeah.
I can probably add a third aspect as well, because our national resources are one thing. The other thing is actually the resources we're given to by the Commission. Because if we have several entry points where we're actually, I mean, as NCPs, we're the client's voice, right? When we're supporting the ones applying to Horizon Europe, and we are supporting the ones applying to EU4Health. This also means that we need our fair share of information and attention from the Commission side. And several networks with several entry points and several points of contact into the Commission will actually also help to transport information and to get different angles and more knowledge actually on our side to support the clients. So this is also a good thing with being more than one. Then again, there might be a future idea of this. Let's think about how many roles can be collapsed into one and if they should be, but definitely the close contact is extremely important.
Just one thing, in just following the Spanish example, in our case, we have some regions, and some of them, they talk about national local points, because we need this type of figure. We don't have this figure, but perhaps we need this type of figure, because it's a big country. We apply to Horizon Europe and also to EU4Health. We are very active in joint action, in all the action. So in some cases, perhaps the national local point, even we need it. So I don't know if it's going to be the other way around. We need to divide the action, the national focal point in national local point. So it's also another discussion.
Katarina, you wanted to say something when I stopped you. Always time that I have the microphone, I see you and you want to speak in that. Graziana, do you want to comment on that? No. Yeah. Okay, I think we are a bit late, and so it was very intense and fruitful discussion, and I think we will have an even more fruitful discussion tomorrow. So please be ready tomorrow, 9:30 sharp, because we have a very busy agenda also for tomorrow, and tomorrow most of you will have also the back flight, so it's important to start early in order to be able to leave you free at the end of the week. Thanks again. I think we have a networking cocktail now, and for those who are not on a diet, because following the recommendation of JACARDI, we should avoid this kind of exercises. Though based on the evidence produced by the JACARDI Assembly and that was shared by Graziano with me, also JACARDI is working on this aspect of not exaggerating with lifestyle, wrong lifestyles. But on the other side, the idea of putting people together based on that picture could be also an idea that could work well. And if you want, we can show the slide if you have it with you. And no, it's better not. Okay, we will share it in the chat. Okay, thanks again, colleagues, and thanks also to the colleagues online for being with us until this late time. Thanks to the speakers and thanks to the previous speakers and panelists.